皆さんおはようございます。
Good morning, ladies and gentlemen. We will begin today with agenda number 4. I will now make my address as a chairperson. Honorable Ministers, distinguished representatives, Dr. Takeshi Kasai, Regional Director, representatives of United Nations agencies, intergovernmental organizations, and non-governmental organizations, distinguished colleagues, ladies and gentlemen, thank you for your trust and confidence in electing me to chair this 72nd session of the WHO Regional Committee for the Western Pacific. I would like to take this opportunity to welcome you again physically and virtually to Himeji, Japan. I thank the outgoing chairperson, the Honorable Health Secretary from the Philippines, the outgoing vice chairperson, the Honorable Minister from Fiji, and other officers of the last session. I will do my utmost to follow their examples and to manage our program this week well. Distinguished colleagues, we heard yesterday the report of the regional director and an update on the COVID-19 situation in the region. Dr. Kasai, thank you for WHO's continuing support to respond to COVID-19, to ensure countries are connected, and at the same time to drive forward our shared for the future vision. On behalf of all member states, we appreciate you and your team's work. Colleagues, we have a busy agenda for the rest of the week, including discussion of 4 major technical agenda items. I would like to provide a brief overview of these items now. First, school health. The Western Pacific region is home to an estimated 611 million children and adolescents, a large majority of whom are in school. Despite advances in health and the unprecedented social and economic development of recent decades, children and adolescents face a range of health risks, including overweight and obesity, lack of physical activity, tobacco and alcohol use, and mental health problems. These issues are a threat to the health of children and adolescents today, but they pose even bigger risks for their health in the future, in particular, the risk of non-communicable diseases. Schools offer a strategic opportunity to address these risks and the risks they pose to future health by entrenching the knowledge, attitudes, values, and skills that children and adolescents need to adopt healthier lifelong behaviors. It is imperative to guide member states in their efforts to make schools nurturing and inspiring environments which reinforce and promote health. The regional committee is invited to endorse the regional framework on nurturing the health of our future generations in the Western Pacific. The second technical agenda item is primary health care, which is critical to achieving universal health coverage and strengthening health security. Though there has been a recent progress in improving access to and outcomes from primary health care, the COVID-19 pandemic has threatened the successes of the past decade. In addition, member states continue to face demographic, social, and economic transitions which have led to rise in the burden of NCDs as well as rapidly aging populations. Addressing these challenges requires strong primary health care, which is integrated, comprehensive, people-centered, equitable, and which promotes health throughout the life courses. This will require us to adopt new and innovative approaches to change how primary health care is governed, financed, organized, and delivered. Given the importance of these issues, we will hold a panel discussion on this topic, and the Regional Committee is invited to share perspectives on the way forward for building health systems oriented towards primary health care for the future. The third technical agenda item is traditional and complementary medicine. Just as the region's rapid economic and demographic development demands, we think differently about primary health care. It also requires us to think differently about traditional and complementary medicine, or TCM. TCM can be harnessed to promote health and well-being, and it is already widely practiced and relied upon by many people across the Western Pacific region. The proposed new regional framework highlights the need to harness the role of TCM in supporting the health and well-being of people in the region as part of national health systems. The Regional Committee is invited to endorse the regional framework for harnessing traditional and complementary medicine for achieving health and well-being in the Western Pacific. The fourth technical agenda item is tuberculosis, which continues to be an important health challenge in the region, one of the leading causes of death from a single infectious agent and a major cause of ill health. While we have made some progress in past decades, it has not been enough. Many people with TB still do not have access to quality TB services. This is especially the case for vulnerable and marginalized populations. Further, the impact of the ongoing COVID-19 pandemic could set the regional back more than a decade in its effort to combat the disease. At the same time, while COVID-19 has presented great challenges to TB programs, it has also created opportunities to develop innovative strategies. The draft regional framework has been developed using the backcasting approach. That is, by drawing a desired scenario for TB in the region in 2030 and working backwards to determine the steps necessary to achieve this goal. Mindful of these challenges and opportunities, the Regional Committee is invited to endorse the Western Pacific Regional Framework to End TB 2021 to 2030. In addition to these important technical agenda items, we will also consider progress reports on critical health issues for our region and a range of other important standing agenda items. These will include the program budget and coordination of the work of the World Health Assembly, the Executive Board, and the Regional Committee. This will include a very important discussion on sustainable financing of WHO and its importance for WHO's work in countries. Excellencies, distinguished guest delegates, thank you again for your confidence in electing me as chair of this important meeting. I very much look forward to our discussions this week. Thank you very much. Before we begin on the next agenda item, draft resolutions have been uploaded on the Regional Committee web portal. If any member state would like to submit an amendment to a particular draft resolution, following our discussion of the agenda items, please submit your suggested amendment by email to the RCM email address. In suggesting an amendment, please use precise language. We move on to the item 7. This is a discussion about the regional director's comments.
So please either press the button in front of you if you are physically here, or press the hand raised button if you are participating on a remote fashion. So first, I would like to invite Brunei, please. Brunei, go ahead.
Okay, thank you, Mr. Chair. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and a very good morning. Chair, Director General, Regional Director, fellow delegates, ladies and gentlemen. Firstly, we would like to congratulate the government of Japan for your election as the chair of the 72nd session of the Regional Committee amidst the difficult and challenging time that you're all facing today. We look to Japan and all member states in their exemplary efforts in dealing with the pandemic. Brunei Darussalam welcomes and takes note of the report of the Regional Director and commends Dr. Takeshi Kasai and his team for the continuous commitments and extensive work done at many different levels in driving forward the vision of for the future amidst the current situation, which is strengthening the progress we have made in achieving universal health coverage and sustainable development goals. Brunei Darussalam's partnership with the regional office continues to strengthen, and our joint efforts over the years have seen progress in areas including strengthening our IHR capacities and access to vaccines and other essential medicines. With WHO's support, we have made tremendous progress in areas of healthy aging, salt reduction, and COVID-19 risk communication related activities. We would also like to put on record our appreciation to the regional office support and attendance at the recent special ministerial conference for ASEAN Digital Public Health hosted by Brunei Darussalam earlier this month. The conference, which among others featured the contribution of digital technology in the field of public health, discussed the opportunities that can be gained from this pandemic. Digital technology potentially addresses many public health issues that we have been talking about for decades. With the extent of enabling environments such as good governance and best regulatory practice, digital health can provide more innovative solutions to our own challenges now and in the future. And we believe that WHO will be able to assist us creating such an environment that will be beneficial to all. Most public health issues require a multi-pronged approach. The burden of mental health that arises from the COVID-19 pandemic, for example, require efforts that goes beyond what the health sector can provide. It is therefore crucial that mental health is elevated higher in the global agenda to address the broader impact of mental health on the social and economic development of every country. Brunei Darussalam acknowledges the grave impact of COVID-19 on mental health in the region. Here, I would like to reaffirm our commitment in addressing this issue by taking the lead in our chairmanship in this year's ASEAN Summit to deliver regional cooperation on mental health under the ASEAN Plus 3 cooperation, as well as the East Asia Summit cooperation. In addressing the COVID-19 pandemic, we would like to express our appreciation to WHO for their guidance and assistance, including on the procurement of critical laboratory and medical supplies and public engagement as part of WHO Risk Communication Network. We are pleased to report that as of 25th October 2021, the Ministry of Health had administered at least one dose of COVID-19 vaccines to 81.1% of the total population, whilst 56.7% of the total population has completed 2 doses of vaccination. Soon, we will be commencing COVID-19 vaccination for our 12 to 17-year-olds. Yesterday, the Brunei government announced the National COVID-19 Recovery Framework, which outlines the various strategies that we hope can bring us out from the current situation. We look forward to work together with WHO in ensuring the effective implementation of the strategies in which the importance of information sharing and exchange of timely and accurate scientific data can never be overemphasized. In building a sustainable and resilient healthcare system in the face of emerging infectious diseases, while ensuring the continuity of other essential services such as the management of NCDs, aging population, and growing healthcare demands, which are still in need of our serious attention, we look to continue our collaboration with WHO and other member states beyond action plans or comprehensive documents to be more focused on creating a guiding coalition for better cooperation in the future. We echo the aspiration in the report to do the right things and to do the things right, and emphasize the achievement of outcomes such that the impact of our collaboration with the regional office is felt by the people in the region. Strategy execution is an important strategy development, and we encourage the WHO and regional office to work in concert with countries to ensure a relentless focus, not just on the what, but also on the how. Brunei Darussalam wishes to remain prominent in WHO's global strategy and agenda in driving the vision for the future towards the healthiest and safest region for the benefit of us all. Thank you.
はい、ありがとうございます。続いて、
Thank you.
ミクロネシア国
Next, Micronesia, please.
じゃあお願いします。ミクロネシア国の
Micronesia, please.
Thank you, Mr. Chairman and honorable ministers, delegates. First, let me congratulate you and your other office bearers for assuming the leadership role during this 72nd RCM. We also send our appreciation to the outgoing president of last year's RCM, Dr. Francisco Duque III from the Philippines. Honorable ministers and fellow delegates, our delegation regrets not being able to attend this RCM in person. However, please be assured that we will participate and engage throughout the entire duration of the RCM. Dr. Kasai, I must commend you and your WHO team for the excellent report about the work of WHO in the Western Pacific region from July 2020 to June 2021 under your leadership, a relatively short period of your time. You've achieved a lot during this period, no doubt. What I appreciate the most about the report is the fact that the content is so country-focused, highlighting key areas of WHO's work that make the greatest impact. We also appreciate the fact that while it focuses on achievement of the present and lessons learned, it always keeps an eye on the future. I guess it's about your vision as well, and how you see WHO evolving and transforming its work to make a difference at the country level, people-centered, I might add. There is no doubt the year 2020 and 2021 were trying times with COVID-19, causing every country to shift focus and priorities. Reallocating of national resources was necessary to respond to COVID-19 in a way that essential services for the chronic diseases, the elderly, and the aged population are not marginalized, and that primary health care services for the unreached in rural islands or villages are not a thing of the past. The technical planning support and constant encouragement through evidence-based practices, examples of what work and science from WHO and partners in this regard are truly appreciated. For us, the Pacific Island countries, FSM truly appreciates your leadership in ensuring the Division of the Pacific Technical Support is equipped with technical, operational, and administrative resources to be able to respond to the unique needs of the Pacific Island countries and areas. Mr. Chairman, as for COVID-19, FSM is still COVID-free. We've been successful in keeping the virus out of our shore, but for how long? As our COVID-19 vaccination is approaching the 80% of the eligible population fully vaccinated, we're moving from a COVID-19 free to COVID-19 protected, where we're slowly opening up our borders to our own stranded citizens and residents and essential workers to come back home. Our goal is to continue to vaccinate as many of our population as possible, as long as we have vaccines. We acknowledge that we could not do this job without the technical, financial, and material support from our bilateral partners, such as the US, Japan, China, Australia, and New Zealand, and also our multilateral partners, such as you, WHO, UNICEF, ATP, and the World Bank. Thank you very much for that support. These partners play a great deal in our COVID-19 response plan, where we are still COVID-free and now moving toward COVID-19 protected. We look forward to technical assistance and support during this COVID-19 protected period. Thank you.
はい、ありがとうございました。
Thank you. So next, Samoa, please.
Thank you, Mr. Chairman. Good afternoon from Samoa. In applauding the Region Director's address and report, I wish to draw on matters that have had value and will continue to have value for Samoa through our government's partnership with WHO. As the new Minister for Health for the independent state of Samoa, I am pleased to acknowledge the Regional Director's exceptional courage and leadership since he came to office in 2019. As such, this fair report under the leadership of Dr. Kasai provides Tinsky qualities for societies like ours undergoing rapid socio-economic modernization. It comprehends the present, but also in tune with the past. It provides an enabling environment for our change agenda with COVID-19, but also tailored towards what the member states are able to contextualize within their own means. For that, we are appreciative. As a Pacific Island nation, we are personally sensitive to developments in our region that affects us. Thus, we are also mindful of those who have lost their own to COVID-19. And I wish to join the Office of the Regional Director in expressing our condolences. In building back better, our emphasis is on the reports focused on enabling the change agenda. like yourselves, the impact of COVID-19 pandemic to Samoa was apparent given the lessons from our history with the 1918 Spanish flu influenza, the 2019 measles outbreak, but our own health structural reforms at the time. Thus, in January 2020, with COVID-19 in discovery, it was necessary to accelerate our readiness and preparedness, plus preventative intervention, and adjusting our response in pursuit of the new normal. With a population of 215,000 by the year 2019, we acknowledge the regional director's call on the 2 points of accountability: to do the right things and to do things right. Our unified belief in the importance of health for sustainable future stems from focusing on the challenges identified and how these are still being pursued, while some aspects have had to change given the COVID-19 pandemic. We had reprioritized our national and sector-wide plans to respond to COVID-19 since early 2020, while ensuring that we continue to focus on strengthening public health, strengthening existing partnership both locally and abroad. To advance our health agenda, the following were realized which are related to this report. Establishing new and strengthening existing partnership to advance health is a strength of this report. Partnership indeed have been a key enabler in driving for the future, and WHO has been instrumental in expediting the receipt by Samoa of AstraZeneca vaccine supplies through the COVAX facility. In the spirit partnerships in good faith, we have also been notably supported with COVID vaccine supplies from the governments of Japan, Australia, New Zealand, as well as the World Bank and the Asian Development Bank. The strength of such partnership has contributed to our current AstraZeneca vaccine coverage the eligible population for the first dose at 94.9% and 65.9% coverage for the second dose. Our Pfizer rollout for the 12 to 17 years age group, the pregnant women, lactating mothers, is officially rolled out today till early December 2021. The Samoa Health System Program, otherwise known as Performance for Results, P4R, was NCD design program. In partnership with the World Bank, WHO, and the Government of Australia, are recent co-financiers of this comprehensive program for Samoa, which has enabled the establishment of the first cascade study for NCDs in the Pacific region, but mainly the PENFA Samoa rollout to the whole of Samoa. The P4R program has been institutionalized into government's financial and procurement system and has been designed to be flexible to also incorporate communicable diseases like COVID-19. In terms of our reprioritization exercise to strengthen our extended immunization program, we have taken a bold approach to our infrastructure and human resource development. Thus, we embarked on establishing a support service infrastructure program to combat and manage communicable disease such as COVID-19 by constructing a new oxygen plant facility and others currently designed such as negative pressure and isolation wards, vaccine storage facility, public health laboratory, 2 new district hospitals, and doctors' residence within the district hospital premises. The introduction of the 3 new vaccines, human papilloma vaccine, rotavirus, and pneumococcal conjugate vaccine, PCV, with the assistance of ADP, the typhoid vaccine, through partnership with University of Maryland, USA, funded by Bill and Melinda Gates Foundation, have been incorporated in our national immunization schedule. This program has facilitated Samoa's COVID-19 development, and together with the world COVID-19. Emergency response project enable our preparation, prevention responses. In terms of leadership, coordination, and support, I wish to note with appreciation the continuous revitalizing of the WHO country cooperation strategy process in our region. It is a mechanism that ensures our taking the lead by aligning WHO support to Samoa's development strategy. For instance, it also ensures that face-to-face dialogue with the representative office in country is regularized and open. In saying that, I wish to end by thanking the RTO in noting Samoa's major challenge with human resource gaps at this time of uncertainty. The appointment of Dr. Pao Ping Yang as the interim WHO representative for the WHO office in Samoa for the last 6 months has been timely and most appropriate. This notable experience as a humanization specialist brought substance to our COVID-19 practical application, and his approach is especially profound. It is such which will be missed. Regional Director, I wish you all the best for regional committee meeting. Tofa Sefua. Paptai.
はい、ありがとうございました。
Thank you very much, Samoa. And next speaker is the USA, please.
Thank you, Honorable Minister Yamamoto. First, we thank the government of Japan for hosting this 72nd WIPRO Regional Committee meeting and are pleased that we can join you in this hybrid format, although we regret that we're not able to be there with you in person. Thank you, Regional Director Kasai, for this report on WIPRO's work to support countries and areas of the region throughout this unprecedented global public health challenge. We wish to thank all WIPRO staff for their dedication, particularly over this past year and a half. And in this, the year of the International Health and Healthcare Worker, we also express our appreciation and gratitude for frontline workers who have sacrificed so much to protect the health and well-being of our communities. We applaud WIPRO's work tackling health challenges through technical cooperation to improve the capacity of national health systems, surveillance, risk communication, facilitating access to key supplies, and support in addressing the challenges specific to the many diverse geographies and communities across the region. The United States values our longstanding partnerships across the region and remains dedicated to strengthening the WHO. And through the Working Group on Preparedness and Response, WHO member states have a unique opportunity to build consensus for a more modern institution that can harness the speed of our digital world. We appreciate the opportunities for dialogue within the region, including on how we can move forward to enhance capacities to prevent, detect, and respond to pandemics and health emergencies. The United States is also committed to ensuring an equitable pandemic response and recovery. The COVID-19 pandemic has intensified inequities at the global, regional, and domestic levels, and we must not allow the pandemic to diminish our goals of achieving equity and advancing health and well-being for all people. We are prioritizing equity in all policies, including those promoting sexual and reproductive health and reproductive rights, preventing and controlling non-communicable diseases, and addressing the broader social, economic, and environmental determinants of health. We look forward to the conversations to come and to the fruitful discussions over the course of this week on how we can increase impact at country level. I thank you.
はい、ありがとうございます。
Thank you very much. Next speaker is from Singapore. Singapore, please.
Chair, honorable ministers, distinguished delegates, on behalf of my minister, Singapore would like to thank Japan for hosting the RCM and Dr. Kasai and the Wipro team for their work in supporting the region's response to COVID-19, while driving priorities laid out in our For the Future vision. COVID-19 remains the top public health priority for many countries as they look to exit the pandemic and live normally with COVID-19. Singapore is no different. Now, listening to Dr. Kasai's report, please allow me to contribute 3 short points. First, we need to protect the vulnerable among us. This is especially so for the unvaccinated, as COVID-19 has now become a pandemic of the unvaccinated in many societies. We need to press on and encourage all who are medically eligible to be vaccinated. Second, we need to take a calibrated approach to return lives to normalcy, yet maintaining measures to reduce the number of people falling seriously ill and overwhelming our healthcare systems. This will be a challenging task, but given the social and economic impact of living under tight restrictions continuously, it's important that we move towards easing restrictions at the right pace so that the various sectors such as schools, sports, businesses, and travel can resume the transition to normality in a safe and controlled manner without causing cases to surge sharply. Third, social capital and people's trust in institutions are equally important. We cannot allow misinformation and distrust to undermine the ongoing efforts to manage the pandemic. Communication is key as we move to become COVID resilient, and we have to ensure that accurate information are disseminated in a timely manner so that we are able to respond quickly and efficiently to this and any future pandemics or healthcare crisis. Finally, Singapore would like to reiterate our commitment working with Wipro and fellow member states to build capabilities in the region to achieve our shared goal of making the Western Pacific the safest and healthiest region. And this is including COVID-19 and other health priorities. Thank you very much.
Thank
you very much. Next, Solomon Island.
Chair and distinguished delegates. Before I make a few remarks, I would like to join the previous speakers to congratulate you on your appointment as the chair of the 72nd Regional Committee of the Western Pacific region of the World Organization. We are indeed living in unprecedented times, which will be with us for a while, and we might just have to adapt with as the new normal. The hybrid regional committee meeting we are in right now, for example, is the kind of innovation and capacity we will need to be explored in health systems development in the future. Samoa Islands is currently COVID-19 free after an initial scare with a total of 20 cases of COVID-19, which were detected in quarantine among incoming travelers. With strict infection control measures we put in place in our quarantine facilities and risk assessment and pre-arrival testing entering the country by air and sea, we were able to prevent community transmission. Our COVID-19 vaccination rollout is reaching even our remotest islands. Vaccine hesitancy, fueled primarily by misinformation circulating by social media, is the biggest challenge we face. However, we are making good progress. Our vaccination coverage as of 16 October is 26% for those who have received their first dose, 11% for those who have been vaccinated, and 37% with at least one dose. Our goal is to reach 90% coverage for the eligible population before we open our international borders. On that note, I would like to thank the regional director, Dr. Takeshi Kasai, for the strong leaders throughout the pandemic and your vision for our region. We thank the WHO, along with other development partners, Australia, Japan, New Zealand, and the People's Republic of China. We are supporting the increasing of COVID-19 testing capabilities, ongoing provisions testing reagents, personal protective equipment, and passing through the COVAX facility and through bilateral assistance. In times like this, we all need each other. We agree that nobody is safe until everyone is safe. I believe this principle applies not only to COVID-19, but to other issues as well. Chair, I thank you.
Thank you very much. Then, Tuvalu, in this meeting, this is the co-chair of this meeting. Congratulations, Tuvalu, please.
Thank you. Honorable Chairman of the 72nd session of the Regional Committee meeting, distinguished delegates and participants here in Himeji, and all those of you who are participating on virtual mode, ladies and gentlemen. On behalf of my minister, who has been elected as the vice chairman for this meeting, it is my pleasure and privilege at this time to be present physically here in Japan with our delegation to participate in this 72nd session of the Regional Committee meeting. First, we apologize that we were not able to be here for the opening of the meeting, as we have just arrived early this morning. Mr. Chairman, we acknowledge the fact that we are still facing these difficult and challenging times due to COVID-19. However, we have made a firm decision to attend this hybrid meeting here in Japan, since Tuvalu will be hosting a hybrid meeting structure for the Pacific Islands health ministers next year in 2022. So we thought it would also be important for us to physically attend this meeting in order to observe the management of such hybrid kind of meetings. And of course, we can ensure a smooth hybrid meeting for the Pacific Islands health ministers next year in our country. Mr. Chairman, first and foremost, I extend our most sincere appreciation to Japan's government through the Ministry of Health for hosting this year's RCM. We also sincerely thank the WIPRO Regional Director, Dr. Kasai, for his strong leadership through this COVID pandemic. We acknowledge the excellent service of the WIPRO's Secretariat for all your support and assistance to support us member states in these difficult times. And of course, our personal friends, Tuvalu, our delegation was able to travel to this RCM smoothly. And of course, WIPRO's support, this travel became a reality despite this COVID border closures and travel challenges. Thank you all so much. Mr. Chairman, although we are pleased to declare that our country is still COVID-free, we just cannot sit back and relax and not continuing work to keep our country safe from this global pandemic. As such, we began our first AstraZeneca vaccine rollout in April 16th of this year, and we just completed our second rollout in the first week of this month. At the completion of our second rollout, Tuvalu has now a full vaccinated eligible population of 85%. Besides, plans are already underway to begin the Pfizer vaccination of our adolescent population, especially between 12 and 17 years, in January next year. One of the biggest challenges in our COVID rollout program was the high reluctance of the general public to come out for vaccinations due to a large extent the influence of anti-vaccine information that have been circulated on social media platforms. However, building on from our experience with AstraZeneca vaccination, we are confident that Pfizer's rollout will be less challenging. Mr. Chairman, unfortunately, NCDs continue to be the leading health issue in my country, increasing financial pressure on our annual budget for curative care services, as well as our referral schemes, overseas and domestic. We have therefore initiated strategies to further strengthen our primary or preventative healthcare services. Some of these key initiatives include the development of our NCD unit with technical assistance from overseas, from our neighboring countries such as Fiji, the reviewing of our health legislations and policies, including our medical referral schemes, and the encouragement of telemedicine in our health system. We believe telemedicine will provide effective clinical care management in these challenging times of COVID-19, especially for vulnerable health systems such as ours in Tuvalu. Mr. Chairman, I take this opportunity again to sincerely extend our government's sincere gratitude to WHO for providing effective support and guidance for member states to be able to respond effectively and efficiently to the COVID-19 pandemic and its uncertainties. I am also indebted to all our donors, our other donors and development partners from our region and around the world for the technical and financial support in terms of human resources, equipment, and vaccines. Without your continued assistance, our country will be overstretched trying to cope with COVID-19 on top of its existing health issues. I am also particularly impressed with the strong commitment and work of our government, health professionals at home, and the Tuvalu communities in keeping Tuvalu safe from this unprecedented pandemic. Mr. Chairman, we hope that all WHO member states, donors, and partners will continue to stand united and collaborate closely together with each other to ensure our national COVID responses and healthcare systems are forever strengthened for a COVID-safe and healthy region and the world at large. In addition, I do also hope that the global and regional COVID responses will not fully divert our focus away from our other pressing health issues. I wish this 72nd session of the RCM fruitful and successful discussions and commitments. Thank you, Mr. Chairman. After
はい、ありがとうございます。
Thank you. Any other interventions or questions on this particular agenda item? Thank you. Well then, I would like to have a response from the RD, Dr. Kasai, please.
Honorable Ministers, distinguished representatives, thank you very much for all your comment and also sharing your experience. And I particularly notice the significant effort that you have made for delivering the vaccines to the people. And I wanted to also appreciate your strong leadership. I also want to take this opportunity to thank again for all of you to work with us, but work with each other. And I have noticed, for example, the Honorable Minister of Malaysia committed in sharing the information. And I wanted to really make sure our region, the regional office, country office, work as one, and to serve as an effective mechanism to continue to learn and improve so that we can better respond to the COVID-19. But even beyond the COVID-19, this mechanism to facilitate sharing information, and we bring our future different. The second point I wanted to mention is that I very much appreciate that we are almost in the same page. We're moving towards the COVID-19 as endemic. Honorable Minister of the FSM mentioned that they're moving from COVID-19, zero COVID-19 to COVID-19 protection. I really wanted to continue to work together, but there's one keyword that I hear in the many interventions, that is that the tailored to each country context. We have those components now clearer and clearer, but then this needs to be tailored into their own context. And I hear from the Honorable Minister of Fiji saying that how effective this emergency medical team in the Pacific. And I wanted to keep note, and then I have to consider how we can continue to promote this mechanism so that we can make effective system in the country. The third, I hear a lot of experience and observations throughout the COVID-19. And as I mentioned in my speech, I think we have a responsibility to reflect those, our experience, observations into all what we are now discussing. And again, Honorable Minister of Brunei and an Honorable Minister of Malaysia point out about the mental health. Actually, before this COVID-19 started, Australia, New Zealand, and the Republic of Korea mentioned about the importance of addressing mental health in a very different way. And COVID-19 gave us a lot of those observations. And today we're going to have, not today, this week we're going to have a side event on the mental health. And I wanted to continue to discuss together how we can create a new style of mental health, but not only mental health. Today we're going to have a primary health care panel discussions. And I wanted to hear as much as possible those kind of input. And in fact that we are planning to have a UHC umbrella technical advisory group meeting in November, where we also wanted to hear countries' experience throughout the COVID-19, so that we can incorporate all those experience and observation in all what we're going to discuss from now on. And I also wanted to commit myself to continue to improve the efficiency in delivering the output in this region. I have noticed also several very important comments. Thank you very much, Honorable Representative from Korea. You had some questions about how we manage the budget. There will be sessions after this, and I will leave that the answer to, I'll leave that discussions to that sessions. But you mentioned about the surveillance for this COVID-19 as endemic. The team is now working together. What is the kind of surveillance that we need in that phase? Obviously, we're not going to report the number of COVID cases every day. We're going to focus more on the severe case if our focus is not to make those severe cases exceed ICU capacity. And it is not something we have example in the past. So this is something I wanted to also discuss together and create our guideline together so that every country can further tailor back into your countries. Now, taking this opportunity, although there were no member states mentioned, I wanted to put one thing now. It's about the sexual exploitations and abuse. Our Director General submitted, received a report of independent review of very unfortunate incident happened in 10th Ebola outbreak in Africa. Immediately, once this report published, I asked all my office to have a session with the staff. And everybody felt very sorry to the victims and survivors. And I wanted to commit that although it's occurred in other regions, I want to take this as very serious in our region and to prevent not to make this happen. And I wanted to make sure that as one WHO, the global plan in managing and preventing this incident to be also implemented in this region. But one thing I noticed listening to the background of this report, there are many backgrounds, but one background is the gender issue. And our For the Future vision paper already picked up that the gender issue is a very important issue. It may require a little bit longer journey, but it's very important for us to continue to address. And I wanted to also make sure that this issue will continue to be addressed in this region. And finally, I wanted to thank all the honorable ministers and then the delegates for commending my leadership, but it's actually opposite. I couldn't have provided that report. It's because your staff, we're working with the member states, and we were able to deliver those output because of your capable staff. And I know that every staff are really working hard, responding to COVID-19, but in the same time, driving the future. And I wanted to appreciate that. But it's also not only the staff, but the partners. I think Honorable Minister of Samoa picked up that for us, from now on, the partnership is going to be more and more important. And I wanted to thank that point, and I wanted to keep that note, and then I wanted to continue to commit working together in making this region one of the healthiest and safest regions. Thank you very much, Chair.
笠井地域事務課、大変ありがとうございました。
Dr. Kasai, thank you very much. So with that, we have completed the discussion on agenda item 7. Next, we'd like to move on to agenda item 8, the program budget. Now already WTO 72.3 and also INF 1 and also 2020 to 2021 program budget, the performance, the interim report, and also from 2022 to 23 program budget update. I believe you have already received this. So at this point, I would like to ask the Secretariat to explain to us what this agenda item is all about. Please start.
Thank you, Mr. Chair. Mr. Chairperson, distinguished delegates, I am pleased to present agenda item 8A on program budget 2020-2021 budget performance interim report, and 8B on the program budget 2022-2023 update. Document WPR/RC72/3 and its annex provides the interim report of budget performance for the biennium 2020-2021 as at 30 June 2021. As you can see in this document, funding, utilization, compliance and controls continue to be strong. Overall, for the Western Pacific region, $273.4 million or 70.8% of available resources of $385.9 million were utilized as at 30 June 2021. This level of utilization is higher than the 2018-2019 biennium by $67.6 million at the same point in time. To mitigate the impact of COVID-19 on the planned implementation of the approved budget 2020-2021, the region at the start of the pandemic developed a shrunk work plan which reprioritized activities for implementation when supporting pandemic response in countries and areas. The shrunk plan activities focused on ensuring that essential services continued, fast-tracking work on health system component essential for the COVID-19 response and responding to requests from member states for specific needs. It allowed countries and areas to achieve progress on their priorities along with the thematic priorities of the For the Future, while supporting governance efforts to ensure that WHO continues to be accountable to member states, partners and donors. Implementation of the shrunk plan was regularly monitored and adjusted with the guidance of the region's program committee. The Secretariat has no outstanding audits and continues to improve controls through strengthened management, training, communications, and monitoring of risks in the region, particularly on donor reporting, direct financial cooperation contracts, and the procurement of goods and services. Gender balance and geographical representation of staff continues to be high priority in the region. Significant progress in gender parity has been made through recruitment policy adjustment and awareness raising among staff over the years. The share of female international staff in the region has risen to 56% as of 30 June 2021, from 50% at the end of 2019. We also continue to reach out to unrepresented and underrepresented countries to improve opportunities for successful recruitment. To track progress on the GPW13, the Global Output Scorecard was rolled out in early 2021 to assess the Secretariat output that contribute to achieving outcomes and impacts of GPW13. For the Western Pacific region, the scorecards include 41 outputs with a focus on the further future towards the healthiest and safest regions as implementation plan of the GPW13. Now turning to Program Budget 2022-23 update, I would like to present information document RC72/INF/1. The Program Budget 2022-2023 was developed during a unique time. The world faced health, social, and economic consequences of an unprecedented scale due to the COVID-19 pandemic. The Program Budget 2022-23 was approved by the World Health Assembly in May this year. In early 2021, planning for the Program Budget 22-23 began by engaging countries and areas in the region. This consultation identified country priorities mapped to the thematic priorities of the further future towards the healthiest and safest region, the shared vision for health and well-being in the Western Pacific region, and the region's implementation plan for GPW13, as I mentioned earlier. The operational planning process will enable work plans to be activated for implementation by 1st January 2022, thereby ensuring WHO remains fully operational. In the approval of the Program Budget 2022-23, the Director General was requested by the World Health Assembly to submit a revised Program 2022-2023, including a revised appropriation resolution as appropriate, to the 75th World Health Assembly in May 2022. This item will be presented and discussed on Friday during the continuation of Agenda 15.3, items recommended by the World Health Assembly and the Executive Board. Thank you, Mr. Chairperson.
はい、ありがとうございます。本議題につきまして、
Thank you very much. With regard to this agenda item that we'd like to entertain the views from each country. Those of you who have opinion, please push on the microphone if you are in this room. If you are participating through Zoom, please use this hands up function.
それではベトナム国お願いします。
Vietnam, please.
Thank you, Chair. Vietnam welcomes interim report on program budget for 2020-2021 biennium. Although facing many socio-economic challenges as well as the COVID-19 epidemic in the world, total program budget utilization as of 13th of June 2021 was $273.4 million, which represented an increase in utilization of $67.6 million as compared to the previous biennium. We are pleased to note the WHO has maintained the trend of the higher implementation in countries, especially in disease-specific health system and vaccine research programs, which are traditional better financed than other programs. It's in accordance with the actual context. We highly appreciate the Secretariat's continued effort to improve control and overall compliance with zero overdue DFCs record kept since September 2050. Besides, we welcome a major shift in the monitoring and reporting of the program budget 2020-2021 across the organization in order to achieve the outputs through a standardized scoring methodology. WHO utilized financial resources for Vietnam in the 2020-2021 biennium its value, in which the substantive portion of the budget allocated for technical support through DFC. We highly appreciated the efforts of WHO to reduce operational costs, including the staff travel costs, and will continue to decrease in the coming biennium in order to reserve a larger budget for priority technical activities, which aims to successfully achievement for WPRO's thematic priorities and operational shift, and the GPW13's triple billion targets. Through joint effort with WHO Representative Office in Vietnam, we are developing the operational plan of Vietnam and WHO Health Cooperation Program Biennium 2022-23, following the ODA management policy of Vietnam. On this occasion, we sincerely thank the technical and financial support from WHO and development partners to effectively contribute to the healthcare system. We look forward to a fruitful collaboration with you in coming years. Thank you.
はい、ありがとうございます。
Thank you very much, Vietnam. Next speaker is from the Philippines.
Mr. Chairman, and good morning to everyone. The gaps in financing in terms of the approved budget and available resources revealed many pockets of poverty in the WHO strategic priorities for the Western Pacific. We note that, except for the target of more people benefiting from universal health coverage, the financing gap was wider for the strategic priorities as compared to the 2018 to 2019 program budget. It really posed a challenge for the implementation of strategies set forth in the 13th General Program of Work. Moreover, the net increase of $131.6 million in the budget ceiling to cover outbreak crisis and response budget for COVID-19 response activities actually exposed the vulnerability of the organization's reserves. The report strengthened our resolve as member states to pursue sustainable financing for the WHO. We also sincerely appreciate the regional office's detailed report on utilization of the current program budget. The Philippines strongly believes that the same level of transparency and precision in reporting on fund utilization should also be incessantly accomplished at country level in order to demonstrate continuous accountability to member states as well as to donor partners. Meanwhile, we laud the Secretariat for immediately developing a shrunk work plan to address the serious impact of the pandemic on the implementation of planned activities. And we therefore would like to emphasize the necessity of faithfulness to the program budget operational planning principles of continuity, because there is much unfinished work to be continued from the current biennium and the principle of fully supporting a bottom-up approach based on country support needs. Regarding the prioritization process for the program budget 2022 to 2023, we hope and look forward to the country office's feedback in terms of the 10 country priorities that was mapped out and incorporated into the For the Future thematic priorities. We also look forward to country offices' further report to member states regarding the conduct and results of a robust prioritization exercise on country priorities requiring the WHO technical support under the umbrella of the For the Future vision that is aligned with the GPW 13 outcomes. Thank you, Mr. Chairman.
はい、ありがとうございます。
Thank you very much. It was Vietnam. Now, we'd like to introduce the South Korea, please.
Thank you, Chair. Upon review of the interim report, it was clear that the regional office demonstrated an extraordinary leadership in the region's COVID-19 response efforts, and that the approved program budget for 2020-2021 was drastically increased compared to that of last year. Since it remains unclear when the next pandemic will hit us, to effectively prepare and respond to it, we need to secure sufficient and stable funding. To achieve our goal of making the Western Pacific the world's healthiest and safest region, it is vital that we sustainably secure the program budget and strategically manage the expenditure. As stated in Annex 1, reviewing the assessments of the new output scorecard methodology along with the program budget will allow us to secure sound funding mechanism. Furthermore, the assessments would also act as a guideline for us to decide which health priorities require more resources. Lastly, the interim report showed that the region has achieved significant progress in the gender balance and geographical distribution of staff. I'd like to commend the regional office for making such outstanding achievement. I have no doubt that the recent rise in the share of female staff will serve as a driving force for WHO to head towards successful reform and transformation. Thank you.
はい、ありがとうございます。続きまして、オーストリア国。
Excuse me. Thank you. Next is
Thank you,
Australia.
Chair. On the program budget 2020-2021, Australia recognises the significant impact the COVID-19 pandemic has had on planned activities, and we commend WIPRO for its work in reorienting priorities to assist member states in responding to the pandemic, as well as continuing to deliver on WHO's general program of work. We would be interested to hear how the office has worked to increase utilisation towards the end of the biennium to ensure progress on work plans is maintained. On audit and compliance, we are pleased to see the fast pace of implementation of internal audit recommendations and WIPRO's work to improve internal controls. We note the significant progress made in achieving gender parity and request a further breakdown of gender representation in the professional and higher duty categories. Australia reiterates our zero tolerance for any form of sexual exploitation, abuse, and harassment. We are encouraged by WIPRO's efforts to implement the WHO's policy on the prevention of sexual exploitation, abuse, and harassment, and the Regional Director's commitment for taking this issue seriously. We would welcome further information on the region's efforts towards PSCAH beyond staff training and how the regional office will engage with the WHO's management response to the Independent Commission's report. We commend WIPRO for its implementation of the output scorecard. Measuring meaningful outputs is critical to promoting accountability, and we commend the region for achieving an overall satisfactory rating. We look forward to further information on work to progress and improve our region's outcomes under the dimension impactful integration of gender, equity, and human rights. Australia reiterates support for the Program Budget 22-23 and its 4 key areas of strategic focus. We would like to make the following points in relation to the Program Budget update. Firstly, we note and support the Office's consultative approach to regional prioritisation. Remaining responsive to current and emerging health issues in the region is an ongoing challenge, and ensuring the budget has the flexibility to adapt to changing requirements and deliver its core functions is critical to maintaining a strong and capable organisation that is fit for purpose. We continue to encourage the Regional Office in their work to strengthen country emergency preparedness and to improve data strengthening and stewardship at the local level. Secondly, regarding the agreement in the 2022-23 budget to a midterm revision to account for the lessons learned during the pandemic, we would be interested to know whether the Office has forecast any activities that will require an increase, not envisaged at the time the program budget was agreed. Noting the lack of detail in the information paper on the expected revision, we welcome further information on the opportunity for Member States' comment on a proposed increase to the 22-23 budget. Lastly, we look forward to the update later this week on the budget process and how regional views will be taken into account. Thank you.
はい、ありがとうございます。続きまして。
Thank you very much. Next is China.
Thank you, Mr. Chair. The Chinese delegation would like to thank the Secretariat for its report on the implementation of the 2020 to 2021 biennial program budget. The report details the budget financing and implementation of country offices in each strategic area up to June 2021. Compared with the same period in 2019, there have been significant changes in the progress of the revenue, expenditure, and budget progress and reasons for these progresses and differences are explained in detail in the report. China appreciates the continued efforts by the Secretariat. The major impact had been on the number 2 for those vulnerable people in emergency contact and well-being improvement. 56% and 68% of the utilization, in particular, the number 3 in utilization rate has been the least. However, in comparison with the overall situation in the WHO, there were also 2 areas where the implementation rate were only 46% and 56%. It is obvious that the region has been minimizing the impact from the impact. We urge the Secretariat and interested parties to implement the responses outlined in the document to ensure the completion of outputs in the 2 focus areas. In addition, we note that in the detailed distribution of expenses, staff expenses, which account for the largest proportion, have decreased significantly compared with the same period in 2019. We look forward to an explanation. Thank you, Mr. Chair.
Any other comments for this topic? If none, may I now call on the Secretariat to respond to the points that have been made.
Thank you, Mr. Chair. Mr. Chairperson, distinguished representatives, the Secretariat appreciates the valuable guidance and comments of the Member States on both reports. I will respond to some of the questions and comments that were raised, and I will then hand over to my colleague, Mr. Jeffrey Kobza, the Director of Administration and Finance, to respond to some other points. On the question on increasing utilization towards the end of the biennium, as you know, WIPRO has a strong culture of close monitoring of all aspects of the program budget implementation. And we provide strategic advice to all budget centers through our program committee, which is meeting on a monthly basis. However, a number of actions have been taken to exactly ensure increased utilization by end of the biennium. So the program committee has increased the frequency of its meeting, and the decision and action point from the committee is then discussed with the program management officers network for further implementation and monitoring. Earlier this year in June, monthly targets were also established towards the end of the biennium for all types of resources. And so this going through the program committee on a monthly basis, it's closely monitored and again going through program management officers network for further action. There is also a weekly monitoring against attainment of these monthly targets. And this is done by our program development operation units, who is following up, and also not only following up, but tailoring its support to each of the budget centers, especially those that are a little bit slower into implementation. With these actions, our projected implementation would be about 98%, which would be consistent with the previous biennium. However, it would represent a much higher utilization of funds of about 80–90 million at the end of the biennium. On the question of transparency, we've heard comments from previous regional committee meetings, and actually our document WPR/RC72/3 has incorporated some further information on countries. There is also the Global Program Budget Portal that provides information on source of financing and the expenditure by budget outcome at the level of country offices. This portal is publicly available on the WHO website, and the results are updated on a quarterly basis. On the question of gender equity and women's rights, and the work to progress in this dimension that was assessed during the midterm review. So as mentioned, the output scorecard approach has been rolled out for the first time this year for the assessment of the first part of the biennium. It's a major shift in monitoring and reporting on the program budget across WHO, including the Western Pacific region. So we are still learning, but in this process, it was also identified that maybe some further clarity is needed on the criteria for this dimension. However, the Western Pacific region had already recognized that putting attention to gender equity and women's rights is really an opportunity to improve health and reduce health inequalities. And this is fully part of the For the Future vision. There is a strong commitment, and our regional director is extremely committed to really utilize this gender equity and women's rights lens, what we call the lens, in all that we do, which is about really thinking how our technical work and our operation, our administration can help to address gender equity and human rights inequalities. So this is about creating an environment which stimulates the change. So it's really about changing the mindset and incorporating this gender equity and women's rights into everything we do. So training is part of it, but that's far from being the only thing. And there are different approaches that have been taken. First, but I'm not going to go through all, but we want to be more focused on process and outcome, not only on rather than products. Want to be more pragmatic, less academic, really what is it that we need to do practically. And also bringing staff to their own moment of realization of utilizing gender equity and women's rights lens, how it will really have a further impact on the work we do. So all this has been incorporated into the operational planning for 22-23. And again, there is a very strong leadership and discussion also among the technical directors. So this is really an area that is taken very seriously. As mentioned, and the regional director mentioned it earlier, it's maybe a longer journey, but we have embarked into this journey and we are moving towards gender equity and human rights and making further progress in this dimension. With that, I will hand over to Mr. Kobza for further response.
Thank you very much. Thank you, Chair. And thank you very much, Member States, for your very constructive comments. Overall, I think we've experienced in the last year the same things you have. It's been a difficult year. We've asked a lot of our staff. We've asked a lot of our collaborators and our partners to make sure we're able to continue with the strong financial implementation controls in place and our ability to support the country offices. But with that, I think we can be quite proud. I would like to thank you all for your help as well from the member states. When we talk about still having zero overdue DFCs, for instance, I mean, that really goes to how we're able to work together and the importance that you all place, as well as we do, on proper implementation, timely implementation, and timely reporting. And we thank you for that. Operational costs, we continually are trying to work within our means. Our leadership budget has been very consistent over the last 3 or 4 biennia. We didn't increase it this year. We've been able to adjust as we've needed to, and we take a senior management approach of, in that area, that if we need to increase, we have to find the needed reductions. So we only increase in that area if we're able to find reductions. And that's a matter of prioritization. That's a matter of going back to our strong networks within the region, with our country office, within the regions, and with HQ as well. So we'll continue that too. I think, that's a very strong hallmark of the Wipro way of doing business. I always love the opportunity to talk about the gender and geographic balance issue that we have globally and targets. Thank you very much for those comments, and we're quite proud. Just to be clear, we've been able to move from 36% professional females in 2014 to 56% today. That doesn't mean we're just hiring females. It means we have our highest quality standards. We get the best person for the job, but it really means we're paying a lot of attention. I have to thank you all as well, especially those countries that are and underrepresented, that have been reaching out, that we've been trying to work with closely to try to identify good candidates and to help with that process. I think we have a ways to go there, but we'll continue, and we really appreciate the partnering in that area. As far as the gender parity at different levels, RD's senior management team is we have gender parity 2 and 2. In our cabinet, we have gender parity. We've continued mobility and movement even during a very difficult time to get people on board because of COVID. And if we have 16 offices off-site, so 15 country offices and a geographically diversified office in Korea, and with the current movements that are going on, which are still ongoing, we will have over 50% females in those jobs too. So our leadership definitely is represented in our gender, and every level, P5 and below, has more females than males. So I think, we take it seriously. Again, our opportunity is to make sure we're reaching out to the right people and getting those who can do to apply, and I think we're being successful, and we'll continue to do that. We take it seriously. For the staff expenditure question, you're absolutely right. Our percentage of staff expenditure has gone down this year, and it's really indicative of the fact that we've basically maintained a steady staffing pattern, maybe a little bit short of what we had a year ago, but we've had to increase support in contracting, and you'll see a big increase in our contracting numbers. So we still have a lot of people on the ground, We find that it's, for some of the things we're doing with COVID, it's easier to hire contractors, consultants to come in and help us. But we're also using this opportunity to give development opportunities to our staff. So many of you will have been working with acting arrangements, officers in charge, new people that we've been able to disperse into different offices and into different functions for COVID. And we've really, I think RD mentioned it earlier, we've seen really impressive results of that, where people we didn't know have the talent have really shown, and we'll continue to do that. I think it's a really good focus for us as well. We take development of staff seriously. We have our own unique ways of managing that, and we really believe that opportunities on the ground for that remain a really good development opportunity for our staff. And I think maybe you mentioned as well, but maybe not, we do have a lot of staff going to other regions and to HQ as well. They're taking our talent, and we have to keep replenishing. So we're continuing to work on that as well. And then finally, the question of the sexual exploitation and abuse, as RD said, we take it very seriously. We will use our already in place networks to make sure that we'll do our best job possible. We already have 3 people engaged with the global task force on this, including at the highest level. DPM is on there. We have 1 country WR and someone from the emergency program in another country. So we're taking it seriously. The management response is very comprehensive. It has some short-term, medium-term, and long-term objectives. We're going to do our best. We're going to, make sure we have dialogue. I think that's one of the strengths of WIPRO is dialogue. And as RD said, we've started that already. We want to make sure everyone's understands the issue and helps us prevent for the future. I think I'll stop there. Thank you, Chair.
Dr. Capano, thank you, and also Jeffrey Kopsa, thank you very much indeed for your interventions. Unless there are any further comments from 21-22, the program budget interim report, and also the program budget 2022-23 update has been recorded. Thank you very much indeed. At this point, I would like to move on to agenda item number 11, school health, 5 documents. We'd like to tackle this agenda item. The Secretariat has prepared a video to explain this, so please watch the video.
Children in the Western Pacific region still face many health challenges and risks. Childhood obesity increased 20-fold between 1975 and 2016. Nearly 6 million children aged 13 to 15 years use tobacco products, and far too many young people consume alcohol. If not addressed, these and other health risks will result in poor health outcomes, including a much greater risk of non-communicable diseases, or NCDs, as today's children become tomorrow's adults. Schools are a place to nurture and inspire healthy living among children and adolescents, for healthier children today and a healthier future. When children learn healthy behaviours and knowledge at school, they can also transmit these to their families and communities. The regional framework on nurturing the health of our future generations in the Western Pacific outlines actions for schools, governments, and partners to help nurture healthy and resilient children who will grow up to become healthy adults. Investing in healthy schools today means giving children and young people the knowledge and skills they need to build a foundation for a healthy future.
I would like to receive interventions on this particular topic. Should you like to state something, please press the button if you are physically here. Those participating on the Zoom, please use the hand raised button. Malaysia, please go ahead.
Schools during the pandemic has impacted greatly on our children. The ramifications of prolonged school closures will not be fully understood until we see the effect in years to come. We must ensure that schools will no longer be shut. That is why Malaysia would like to once again call for the equitable distribution of COVID-19 vaccines for children when they get regulatory approval. This will protect all our children to learn safely at their schools. Please do not repeat the inequitable delivery commitments that we are seeing for vaccines to date. The pandemic and school closure has also had significant effect on the mental health of school children. This is compounded by the effect of social media on shaping our children's thoughts, feelings, and behavior. It is imperative school children should be given adequate mental support. In this regard, Malaysia will place more resources and efforts in providing the necessary interventions for students who need assistance, especially through using technology tools that may be more familiar for a digitally native generation. Malaysia acknowledges the importance of nurturing healthy and resilient future generations through schools and education. WIPRO's effort to invest in education system towards a more supportive and safe environment in nurturing optimal health among children is highly appreciated. Malaysia continues to remain concerned about the double burden of malnutrition on children. We have set up a bipartisan whole-of-government task force to address the issue of stunting among some of our children in Malaysia. Finally, Malaysia would like to raise the issue of the campaign on tobacco control for health-promoting schools. In particular, we would like more focus on electronic nicotine delivery systems, or ENDS, and a common position on the prevalence of ENDS among school children. Malaysia will soon be joining some other member states in regulating ENDS, or electronic nicotine delivery systems, especially in ensuring that they do not become accessible for school children. Thank you.
Japan, Nippon, お願いします.
Japan, please.
Thank you, Chair. Japan welcomes the regional framework on nurturing resilient and healthy future generations in the Western Pacific. Japan also shares the view that childhood and adolescence are key life stages where many of the causes and potential solutions for the four thematic priorities for the future reside. As examples, Japan takes measures to fight against drowning amongst children, equipping schools with swimming pools throughout the country. This is also an effort to improve children's health. We also provide school lunches in elementary and middle schools, which are supervised by nutritionists, so each child or adolescent has an opportunity at least once a day to nurture good dietary habits as well as friendships around lunch tables. The COVID-19 pandemic has provided new options in the school environment, such as provision of online classes, but on the other hand, it had countless detrimental effects as it reduced opportunities for daily direct interaction of students at school, taking away valuable life events like excursions and sports day, school entrance, and graduation ceremonies. Japan recognizes the importance of schools, families, and communities to collaborate and respond in every possible way to implement school education activities, ensuring that no child is left behind and that learning is maximized even under the impact of COVID-19. In order to implement healthy learning while taking countermeasures against infectious diseases, Japan has prepared the Hygiene Management Manual for the new coronavirus infection in schools and other hygiene manuals which are revised in accordance with national infection numbers. Under the COVID-19 pandemic, we have reaffirmed that it is more important than ever for health and education to work closely together. We hope UPRO will continue to develop this valuable framework by adding more recommendations that can be applied to COVID-19 situations. Japan would like to continue to contribute to the health of children and adolescents in the Western Pacific region and the world, thus to the prevention of future NCDs, in cooperation with the Western Pacific Regional Office and the WHO by sharing our country's lessons and experiences in school health through this pandemic. Thank you, Chair.
ありがとうございます。続き
Thank
ま
you
して
very much. It was Japan. Now next speaker is from China.
Distinguished delegates, the Chinese delegation carefully reviewed the draft regional framework on school health. China agrees with the proposed situation and agenda for school health, and we appreciate the solid and effective work carried out by the committee. The draft framework sets out specific recommendations for each goal and provides good reference for schools and the governments on how to better promote health in schools. However, given the huge differences among WIPRO states in the national policies and practices of school management, it is hoped that WIPRO will actively communicate with member states, provide specific suggestions on how to promote relevant efforts, and choose the best practices to promote the cooperation of intra-regional exchange and collaboration. China has long attached great importance to the sound development of children and adolescents and has incorporated children and adolescents as key groups in health promotion in the Healthy China initiative. We've formed a pattern of school health and health education in the new era in which government-led departments cooperate with schools for social participation and with the family at the core, achieving milestones and concrete results. To improve the health of children and adolescents, it requires the cross-sectoral and multi-stakeholder cooperation. China will continue to strengthen the interdepartmental cooperation mechanism and actively strengthen exchange and cooperation with other member states of WHO and other international organizations to jointly promote the healthy development of children and adolescents. Thank you, Chair.
Thank you. So now time is running short. So as to the other matters, we'd like to postpone later. So let us now break for coffee. So before the coffee break, the General Affairs Department Manager has an announcement. So we have the announcement from the Secretariat.
Thank you, Chair, very much. The daily journal is now available on the WIPRO website, so please note any edits or corrections needed and submit to the inquiry desk here or to the inquiry desk email address if you have any. Secondly, the list of representatives has been posted on the member states portal, so we'd also ask if you could kindly verify the information of your delegation to ensure its accuracy. And if you could send to the RCM mailbox any changes, we'd like to try to finish that by noon tomorrow, if possible. So thank you for your help on that. Today after coffee break, there will be a panel discussion on primary health care, followed by the plenary discussion on the same item. And later today, we have a side event on innovation, and we're having it here in the plenary hall. And for safety measures in related to COVID, we would encourage seating arrangement be unchanged, except for we'd ask the head table to remove their personal items because we'll change that up a little bit for the side event. After the session today, there'll be a physical excursion for invited participants here. Those going are asked to take the shuttle back to the hotel at the end of the side event. Go to the hotel, change into comfortable and warm clothes, and to catch the shuttle to the port at 3 p.m. from the hotel. And we have a bit of a tight time schedule for that, so if people can really be downstairs at the shuttle at 3 p.m. who will be going on the excursion, we'd highly appreciate that. The Rapporteurs meeting will again be at 3:45 p.m. At room 408 on the 4th floor. And then tonight, for those of us lucky to be here, the Regional Director will be hosting his dinner for the participants at the Belvedere Function Room, 3rd floor of the Hotel Monterey, starting at 6:30 p.m. For tomorrow, the session will start at 7:45 a.m. with part one of the discussion on primary health care to accommodate the time differences of the member states. There will also be the informal consultation with member states tomorrow. This is also known as the caucus, and it will be held in this hall starting at 9:30 a.m. And as you know, this caucus is attended by the chief representatives of member states with seats of government in the region and addresses issues such as office bearers for upcoming global governing body sessions. Finally, even though it seems we've only just arrived, we need to start working on everyone's safe return home. So for required RT-PCR tests for the travel home, please refer to the inquiry desk or through your liaison officer so we can make the necessary coordination and arrangements. Thank you very much, Chair.
Thank you very much. The information by the administrator. So, of course, always at the WHO meeting has exercise, so that we now like to have this exercise, the demo, right before this coffee break. So please join on the demonstration of this, the WPO.
ก็มันมีความภาคภูมิใจที่ว่าได้เป็นพยาบาลถึงว่าจะอยู่เขตห่างไกล2 ลิอยู่บอนที่ว่ายุ่งยากเนาะแต่ว่าก็ภูมิใจที่ว่าได้
Recording stopped.
ข้าพเจ้าเฮ็ดเวียกอยู่นี่ก็ได้16 ปีนี่แล้วว่าซั่นซะหมายความว่าคนเจ็บที่ว่ามาหาเนาะมันจะเป็นรุ่นตัวอย่างแนวผู้ที่เอาดูกมากวดแล้วก็ได้รับการปิ้นปัวบางคนก็เติบเยอะมีลูกเนาะก็พัดได้มาปิ้นปัวนำท่านหมอนำข้าพเจ้าอีกกิจวัตรประจำวันข้าพเจ้าเกิดมาก็แต่ว่าทำออกกำลังกายย่างออกกำลังกายเบาๆหลังจากที่ว่ามาฮอดสุขศาลาเนาะทำอีกเฮาก็กวดแล้วก็ให้ยาบ่แล้วให้คำสุขศึกษาให้คำปรึกษาเกี่ยวกับการรักษาสุขภาพข้าเจ้าถ้าหากบ่มีพยาบาลหรือว่าอาศัยอยู่คงเขียนนี่เนาะประชาชนนั้นก็จะจะบ่ได้รับข้อมูลข่าวสารจากการแพทย์เฮาจะบ่ฮู้เกี่ยวกับการวิธีรักษาสุขภาพจะเฮ็ดให้มีการเกิดพยาธิเป็นต้นก็จะมีการเกิดพยาธิระบาดหลังจากว่าเฮ็ดเปียกมาทั้งวันถือว่าภาคภูมิใจกลับบ้านได้รับใช้ผู้มาบริการสุขภาพเฮ็ดให้คนอื่นนั้นมีสุขภาพดีมีสุขภาพแข็งแรงแล้วเราก็ได้รับผลประโยชน์
When my anxiety is really bad, it kind of starts as just like I'll wake up and it's this worry. And then the worry just slowly creeps up a notch and it goes into a little more anxious, and then it creeps up a notch and it goes to like really quite anxious, and then it goes to a little bit of panic, and then it's almost like it goes through the panic to just this numbness or this complete like overload. I live with my husband and my little boy who's just went 19 months old. When I first heard about COVID-19, didn't really think that it was going to be a problem for us. And I just remember going to the supermarket and just it being this real reality check, because there are markers all around the corner, 6 feet. So everyone has to stand 6 feet apart. Everyone's wearing a mask. And it took me a long time to actually realize kind of the enormity of the situation. I was diagnosed with generalized anxiety disorder in my mid-20s. So much affects my anxiety at the moment. I think it's just because there's so much unknown still. Like, what does it look like at the end of this? Is there going to be an end to this? I struggle with not having friends around. Physical distancing is tough because I can't have that connection that helps me so much. On the days that it's really bad, it's really hard to know what to do to come out of that, especially when you have a toddler going, "Mommy, mama, mama," and I'm like, okay, I know I need to step away to take care of myself, but I know he needs me. And then just feeling the shame of feeling that way and not being able to get on with it. So in terms of self-care, I'm definitely trying to limit the amount of news I take in. I've started doing some counselling over the phone, which has been great, to actually just talk in depth with a trained professional. It's like a release. We've got to grab those moments for self-care. So even if I just get 20 minutes of yoga in the morning, it just feels so good to have carved out that little bit of time for myself to do a little bit of physical activity. I think we really need connection at this time. I know for myself with my anxiety, if I am alone too much and I don't reach out to other people, that I tend to go very dark. So I think connection is beyond important. I think everybody is allowed to be affected by this because we're all affected by this. Everybody's allowed to be worried, and it's okay. And we're all in it together.
如果不是因为这样一场疫情，我从来都没有觉得像我这么渺小的人，原来也可以为自己的国家吧，为自己的城可以去奉献一点点什么。 突然之间不是就看到一篇报道，就说武汉是封城了，然后就看到朋友圈里面铺天盖地晒的就是到了个出口嘛，路口上面全部都堵车了，说10点钟就出不去了。朋友圈里面突然间有一天就会发了一条朋友圈，说明天就会有一趟运送物资，现在缺车缺人。当时我就加入了这样一个群里面去了。那时候就说封城了之后，知道吧？说医务人员吃不上饭，所以说当时就是报任务，医院里面报你们需要多少份，我们就送多少份去。在疫情期间啊，我每天几乎是准时5点钟起床，去拿货，就去送到医院里面物资里面去，不停的送，不停的跑。这个上面，社区这边的一些居民，他们的物资也是非常紧缺的，帮他们去采买物资。我开着车子，武汉3镇，我后面都跑了30几家药店，才能买齐。从你进门脱防护服，卸身上的这一套装备，1个小时，差不多上床睡觉，有时候就几乎都是凌晨2点了，然后睡个2、3个小时，又要起来就去。在这个做志愿者期间被歧视，那肯定是必然的呀，不让我们回家。我在车里上面睡了2个晚上，小区里面不让我们回来。那一刻，其实在车上的时候还是挺委屈的。但是，一清早起来之后，又开始去执行任务的时候，又忘了。有时候我回到家里面，很累了，知道吧？家里面门口就会放着一些水果呀，然后有时候还会有一些小朋友贴了一些纸条子啊，我就觉得再累啊，我就觉得我挺值得的。我从来都没有觉得像我这么渺小、这么普通的人，原来可以被别人称之为英雄。我们所有的人凝聚在一起，每个人都尽自己的一点点心，出自己的一点点能力，它就会变成了一股大的力量。
我感染 SARS 的时候是2003年1月份，那时候还搞不清到底是什么病。我带了几个医生，几个学生，还有几个工人，一起送一个呼吸急促的危重病人，在一个很小的电梯里面。那么所有的这9个人后来全部病了，而且病得都很重，是这样感染的。58岁了，当时病得很重，血氧很低，1、2个月平卧在床上，不能吃饭，不能起来。起不来，不要讲起来，起来一点都不行。我才知道缺氧这个滋味因为我看过很多病人，但自己没滋味。我的目标就很卑微了，我就想做一个好医生，能够帮助人家解决一点问题。一个好的医生是2个方面，一个有一颗知道同情、怜悯、感恩的心。第2个，他有比较好的判断和知识，能够实实在在的帮到人家。中医的话呢，它讲是望闻问切，大概讲起来呢，中医呢，一个他要了解病情，他病人有各种感觉，他感觉到这个病在怎么作怪，怎么破坏，他这个感觉非常重要的。中医看100个病人，即使这里面有很多是相同的，100个人都不同。实际上，在我们观察社会的时候，每一个个体都是一个奇迹，每一个生命都有特点。这里现在病人多的话呢，老人多，另外青壮。他一般老人的风湿痹痛、到处疼痛，这个多有的是慢性病。饮食调理是中医的一个特点，也是很多病人的习惯。 啊，他看病看完了，最后他还问你哦，我应该煲什么汤，都是这个问题。这个月我就退休了啊，什么样东西都看过了啊，看惯悲欢，也看过离合，反正我想还是应该努力，因为我努力了这么多年了。
Ni garewang plapesen. Hem som timba, but soya hem godan chopem nan legia. Chopem out legia para out na. Mistelo clinic lo saro, mi se leva lo dia det fatay. No any doctor. Dat flamania insat lo bus na para wetu lo bus fokam kasem clinic soon sem kasem clinic mi aku wata lo hem IV lo hem fluid for help hem from me right nama lo patient for him no can soak because staka blood ba hem go out radio blomi fala hem no function good to no ma mobile network no kasem lo there dressing lagi blehem mi pakem staka goes for holem po hem cloth na blood ya then mi fala gona mi fala no weight mo mi pasa golo po mi bara fry to myself because distance far then bahem taken 4 hours ya for come lo boat hem wake hem you talk with them hem mi just comforting patient no ma that hem bahem no worry no fright hem alright no ma di falago ba help hem same time otaka sem therapy so se patient hem lack for go sok na and ambulance mo for come down so legia out in na so this time me go back holiday me looking patient hem lo home lo village hem say oh thank you too much if I bara help me save him life do me now me happy and to ko say me happy me say him good me fal always there for help him na people sick for care look at everywhere me go save him life do everywhere.
In secondary school, there would be this bully that would take my stuff and throw it across the class, and if I tried to stop him, I would be hit. And at some point, I went up to ask, why are you doing this to me? Why me? What did I do to you? And the response was, because it's fun. Having experienced bullying in the past, I understand the effects it can have on people, and it gives me a strong motivation to address it. In primary school, I would be thinking I was playing around with these upperclassmen during recess to take my snacks, throw it on the ground, crush it, and I didn't know it was bullying at that point in time. Fortunately for me, my form teacher found out and she actually went to address the situation, but it happened again in secondary school. It got way worse. I would dread going to school, and just before I enter the classroom, I would always stop outside and wonder, what is this guy gonna do to me today? And this caused me to feel very unmotivated with anything to do with school. Back then, the stigma for mental health was really bad, and there was a very negative association with therapy, and there was a sense of shame that we had in walking to the counselor's office. So at that point in time, it was not on my mind at all to see the school counselor. As the bullying affected me more, I used running as a main outlet for managing my emotions, managing my mind, and because of that, I managed to break out of my depressive emotions. Currently, most solutions to bullying require the victim to tell someone they're being bullied, and I find it weird that we're placing the burden on the victim instead of targeting the exact source of bullying. As a computer engineering student, I have technical expertise, and I thought of an idea to address bullying using empathy, and AI. So I'm creating this tool, Empathly. What it does is it's a keyboard extension that tells the user what the other person might feel receiving their text before they receive it. Right now, all schools in Singapore use laptops for learning, and empathy is not something you can build in one day. It's something that needs to be worked on like a muscle. Being in school right now, I still see bullying happening around in the classrooms. What needs to be improved on is to create a positive mental health culture where people actually talk about it openly, and we're also making more students think about mental health in a school setting and helping to contribute to their own school community.
복지관을 천국이라고 생각해요. 그러니까 매일 오시니까요. 그런데 이제 닫았으니까 답답하고 갑갑한데 저는 여기 종로노인 복지관 이화동에 사는 75세 난 할머니 이건희입니다. 코로나19 전에는 복지관에서 생활을 많이 했어요. 가장 먼저 시작한 것이 사진 찍기. 여기서 이제 사진 찍기 활동을 시작했고요. 일본어 공부를 했습니다. 저희가 2013년부터 장금이 봉사단 활동을 시작했습니다. 장 카페가 있어가지고 거기서 정통 음료, 수정가래든지 같이 판매하고 있어요. 괜히 내 자랑하는 것 같은데 기타 악기 공부를 시작했습니다. 학준자 중에 우리 동아리 한 분이 계셨어요. 자기가 국립의료원에 들어가서 독방에 있으면서 감옥에 있는 것 같다 하면서 카톡도 이제 주고받고 했어요. 그분도 이제 완치돼서 나왔고, 또 우리도 양성으로 나오면 어떡하나 굉장히 겁을 먹고 확진자다 그러면은 이퀄 사망으로 생각하게 되더라고요. 굉장히 불안했었죠. 이제 음성이라고 판정이 나고 그래서 이제 조금은 안심했지만 처음에는 이렇게 장기간 될 거를 몰랐으니까 연기되고 그래서 이제 우리 복지사들이 전화를 줘요. 그 확진자들의 그 동선이나 종로구에서 발생하고 몇 명이 치료 중이고 몇 명이 뭐 완치가 됐고 이런 거를 메시지로 다 넣어줬어요. 어르신들이 저를 이렇게 대표로 밀어가지고 전화해가지고 언제 여기 복지관 여느냐고 거의 뭐 10년 이상을 같이 지내다 보니까 마치 가족같이 지냈었습니다. 특히 우리가 노약자다 보니까는 그 위험성이 더 높잖아요. 이 모임을 안 갖고 인내하자 그래서 이제 카톡으로도 얘기하고 그래요. 조금만 더 참자 하고. 내가 더 거리두기를 잘하고 그 생활수칙 뭐 손 씻기를 이제 마스크 하는 거를 더 잘해야겠다. 복지관 개관하면은 저는 우선 그 프로그램 다시 할 수 있었으면 좋겠어요. 그동안에 못 봤던 얼굴들 보게 되고 활발해질 것 같습니다. 아무래도 우리가 생활수칙을 잘 지켜야지 이걸 이겨낼 수 있으리라고 생각합니다. 갑갑하고 그랬지만 고진감래라고 우리가 잘 이겨내서 좋은 시간 만들었으면 좋겠습니다.
Recording in progress.
Basically, time my family really find out to me got sick TB, all Fred, Lomi, no been gonna keep me loud sick too. Also, less foxes last sick. We can't stop too sorry. Honestly, I don't think me, honestly, stop close to one to me. All plate to me, spoon to me, put it separate. Ito ko, sika yung nahuti pa, gini praso. O put it separate. Ano sa stop close to one to me, try to talk to ko, si mixing them sa spread through air. Time me cough, na mi sabi ako sick as a spread. Ito not ang fret in use lang. All community pa mi, looking na ba ito backside mo to. Yan yang pagkailan looking ang sisik sa nabot sick TB. O sa to backside na to kasi nabot. Now, all start looking at the time you vaccination, me existing no me beken. Na me look alright. Sweat number na pelpe number te also sign when me sa looking men. Time you start vaccination ko help me. Na me no sort when me feeling alright inside the body to me feeling alright. Help assistant to me agata and help me make sure that me must work every day lo. Those side look simarasin. All well vision to say kami palo side kai na basfe. Then like help me pla lo mi paken like amas look simarasin no kami to. Sa COVID too mi start like kind now time sen mi sick mi got sa sick bito na mi sa wario sen mi vaccine la COVID-19 too. And banana butta lo side because mi got all the sick stuff finish. So the only way me making me must wear a mask. All the time me go me must wear a mask. Me find out the same TB you can fight in TB back and end the life if only you simarasin faithfully and you go back into normal skin you can go back into life. Go back into on and dream you go back into school on and as long as you must be simarasin so then I'm by right.
高校1年の時に私は父をがんで亡くしてまっすぐ帰ってきてみんなが帰ったところでちょうど集まったところにお医者さんが呼ばれてきて息を引き取るのを本当に横で見ていたという印象的でした。看護師になろうと思って今では在宅死は 13% ぐらいでしょうかっていう状態なので一気に病院化が進んでしまった。1990年に私の2つ上の姉を末期の肝臓がんで、余命1ヶ月ということでそういう宣告を受けたんですけれども家に連れて帰って療養したんですね。1989年から90年今から30年前っていうのはがんの人を家で見るっていうのは無謀というのかほぼないというのかただ14歳と11歳の男の子2人いまして家に連れて帰ってきて子どもたちと一緒にいる時間を増やしたというかやっぱり誰とどこでどんな風に過ごすかっていうのはとっても大事なことだと、そこで気がつかされたっていうことですよね。家族と一緒に家で過ごしたいっていう人のために看護を届ける仕事つまり病院から出て人々のところに出向くというそういう在宅医療や訪問看護そういうことが必要なんじゃないかなと思いました。訪問看護の道を進み出したんです。ここは2011年7月にオープンしました地域に開かれたよろず相談所暮らしの保健室と言います。どんな相談でも受けられるところ健康相談やら医療や介護のこととかやはり高齢の方の問題に対応することが多いです。本当に満足がいく最後を迎えられた方もこのご近所にもいらしたり今目の前にね現れているその人々がやっぱりとてもユニークな人生をそれぞれ歩んでこられているのでその方たちのその人生に敬意を払いよく話を伺うっていうか聞くっていう姿勢を貫いていくとその方の経験が私の経験にもなりでそのことをまた人に語ることでまたその経験が生きていく。
それではプライマリーヘルス
Well, ladies and gentlemen, let us now start the panel discussion on the primary health care and the document number WPRRC74. Now, I would like to introduce the moderator for our panel discussion, Mr. Martin Taylor, Director of Health Systems and Services. Mr. Taylor, please.
Thank you very much, Chairperson. Honourable Ministers, respected delegates, good morning, good afternoon and good evening, and a very warm welcome to this panel discussion in which we will explore the future of primary healthcare in the Western Pacific region. Can we play the introductory video, please? In the Western Pacific region, 1 in 6 people will die from a non-communicable disease before they reach their 70th birthday. By 2050, countries in the region will also have twice as many older people as today. Primary healthcare provides services that restore and maintain the highest level of well-being along the life course. It can build on innovative technologies to take better care of people closer to where they live. Individuals are empowered to participate in and make better decisions about their health. Primary healthcare also promotes working with other sectors to address factors beyond health that affect people's well-being. WHO is working with member states to create the primary healthcare of the future, which enables all people to get the best care right in their community throughout their life. As we just saw, we live in a rapidly developing region, and in this panel we will explore the future of primary healthcare in that rapidly developing region. To help us on this exploration, we are extremely privileged to have 4 ministers who will share their country's visions for the future of primary healthcare. But first, I'd like to introduce our Regional Director, Dr. Takeshi Kasai, to share his opening remarks.
Thank you very much, Honourable Chairpersons, distinguished representatives. I'm extremely pleased that we have these panel sessions on the future of primary healthcare in the Western Pacific region. 2 years ago, when we discussed the For the Future vision, we identified the primary healthcare as key to the future of our health system and to achieve universal health coverage. Member states in this region have made tremendous progress through primary health care in improving hygiene, reducing communicable diseases, and improving immunizations, etc. However, the challenge of our region faces in the future is a different challenge. It includes the increasing burden of non-communicable diseases and rapidly aging populations. This requires that health system transform to meet these changing needs. And we need a new approach to create the primary health care of the future, not a repetition of the frameworks on the primary health care that guided us through the challenges that we have faced in the past. I really wanted to collectively generate a new vision of primary health care, and I'm really hoping that the panel discussions today and the member states' contributions tomorrow can help us identify the key components of this new vision. We're having these discussions in the COVID-19 time, from which we can capture some of the innovations and adjustment to primary health care that can inform our future vision. And I'm particularly grateful to the honourable ministers for joining us on this panel here today. Many of you may recall the panel discussion that we held last year? It was 2 years ago. I start to lose my memory of the aging, where the previous honourable minister from Singapore shared a Singaporean experience and their vision. It was so stimulating. And that's the time honourable Singaporean minister said, it's not the silver society, but why don't we call it gold society? And it was a very stimulus discussions. And we're very much looking for these sessions to have those kinds of stimuli so that we can generate our joint vision of making new type of primary healthcare in this region. Thank you very much.
Thank you very much, Adi, for setting the scene on why this panel discussion is so important and also so timely. I would like now to turn to the remarks from the Honourable Minister Silas from Vanuatu to introduce his country's plans for developing primary health care. Unfortunately, the Minister can't be with us today, but he has recorded his remarks. So can we please play Minister Silas' remarks?
Vanuatu is an island country with a population of approximately 300,000 people who are distributed over 65 islands. Our gross domestic product per capita is around $3,000. We have high rates of non-communicable diseases such as hypertension and diabetes. We also have high rates of the risk factors for developing those non-communicable diseases such as consumption of unhealthy foods leading to obesity, and tobacco use is quite common. In our rural areas, we still have the challenge of malnutrition in children, as well as many tropical skin diseases such as scabies, head lice, and soil-transmitted parasites. We have recently eliminated malaria in urban areas, but there is still transmission in some provinces. We are working closely with the WHO and other partners to roll back malaria throughout the entire country with a target for complete elimination by 2024. This year, we introduced our new health sector strategy for 2021 to 2030. Primary health care is the foundation for achieving universal health coverage, and our revised strategy focuses on strengthening primary health care in Vanuatu. Our first focus will be to assist the provincial health officers to strengthen their management and supervisory roles for their primary health care facilities. We have recently revised the core set of public health indicators and also set up our DHIS2 data platform. So part of the support will be assisting provincial health officers to actively collect, analyze, and use their data for their annual planning processes. Human resources for health are a big challenge for Vanuatu. We cannot successfully strengthen our services without sufficient well-trained staff. This is a challenge that we share with many of our Pacific neighbors. We are working with the WHO and partners to develop curricula and training programs to upgrade our community health workers to a more skilled community nursing system. The second focus is to expand our coverage by improving health service delivery to remote and unreached areas. We will assist the provincial and peripheral health facilities to organize integrated outreach services with input from communities. We currently have a lot of training planned from technical programs for NCDs, MCHs, and communicable diseases. Over the last year, many activities were delayed due to COVID-19 preparations. However, we are eager to restart our programs. The third focus is on increasing community engagement. There are village resource persons such as village health workers, village leaders, and community health committees through which the government can cooperate to strengthen health programs in communities. Vanuatu recognizes that primary health care is the most inclusive, equitable, cost-effective, and efficient approach to enhance people's physical and mental health and social well-being, and acknowledge the need for a strong primary health care force. Thank you.
Thank you, Minister Silas, for sharing with us some of the key drivers of reform for primary health care in Vanuatu. You highlighted in particular the high levels of risk factors for non-communicable diseases, and also for sharing some of the actions that you're proposing to take in your new health sector plan. I'd like now to turn to our second video, which explores the importance of primary health care in rural Lao PDR. Can we play the video, please?
ก็มันมีความภาคภูมิใจที่ว่าได้เป็นพยาบาลถึงว่าจะอยู่เขตห่างไกล2 ลิอยู่บอนที่ว่ายุ่งยากเนาะแต่ว่ากับภูมิใจที่ว่าได้รับใส่ตามหน้าที่ข้าพเจ้าเฮ็ดเวียกอยู่นี่ก็ได้16 ปีนี่แล้วว่าซั่นซะหมายความว่าคนเจ็บที่ว่ามาหาเนาะมันจะเป็นรุ่นตัวอย่างแนวผู้ที่เอาดูกมากวดแล้วก็ได้รับการปิ้นปัวบางคนก็เติบเยอะมีลูกเนาะกับพัดใดมาปิ้นปัวนำท่านหมอนำข้าพเจ้าอีกกิจวัตรประจำวันข้าพเจ้าเกิดมาก็แต่ว่าทำออกกำลังกายย่างออกกำลังกายเบาๆหลังจากที่ว่ามาหอดสุขศาลาเนาะทำอีกเขาก็กวดแล้วก็ให้ยาบดแล้วให้คำสุขศึกษาให้คำปรึกษาเกี่ยวกับการรักษาสุขภาพข้าเจ้าถ้าหากบ่มีพยาบาลหรือว่าอาศัยอยู่คงเขตนี่เนาะประชาชนนั้นก็จะจะบ่ได้รับข้อมูลข่าวสารจากการแพทย์เฮาจะบ่ฮู้เกี่ยวกับการวิธีรักษาสุขภาพจะเฮ็ดให้มีการเกิดพยาธิเป็นต้นก็จะมีการเกิดพยาธิระบาดอาจารย์ว่าเฮ็ดเปียกมาทั้งวันถือว่าภาคภูมิใจกลับบ้านได้รับใช้ผู้มาบริการสุขภาพให้เธอคนอื่นนั้นมีสุขภาพดีมีสุขภาพแข็งแรงแล้วเราก็ได้รับผลประโยชน์
This video highlights the importance of primary healthcare to the people of the Western Pacific whom we are serving. Now let us turn to our conversation between 3 ministers who are leading reforms to create the primary healthcare of the future. I'm really honoured for this conversation to introduce, first of all, the Honourable Minister Ong Ye Kung from Singapore. Good morning, sir. Secondly, I'd like to introduce the Honourable Associate Minister of Health, Opito William Seo from New Zealand. Good afternoon. And lastly, but definitely not least, I'd like to introduce the Honourable Minister Amelia Tuipulotu from Tonga. Thank you all for joining us for this conversation. So we'd like to explore the future of primary healthcare in the region. First of all, I'd like to start, if I may, with Minister Ong. Minister, we've heard about the Ministry of Health's Office of Healthcare Transformation and its work on primary healthcare. Could you tell us, please, why an early focus of the office is on the future of primary healthcare?
We started this office really to try out new ideas to transform not just primary healthcare, but also clinical practices throughout the system. Really, the idea is that they should be the skunk works. And when they stumble upon a good idea, we should try to make it national policy. Our view is the question for us is not so much what is the future of primary healthcare, but that primary healthcare is the future. And how are we going to make that leap to put emphasis on primary healthcare? And I think for many countries in our process of development, this is something we will have to grapple with. When Singapore was in the backwaters and not very developed, that's when I was a kid. Primary healthcare is important. There are not many hospitals. There's just one hospital that we run to, which is the Singapore General Hospital. But for us, any medical ailments, we will run to our doctor near our village or in our estate. And therefore, that's the primacy of primary healthcare at that time. But as we develop, we have more hospitals, we have good doctors, clinicians, good practices. And as the hospitals build up, we start to run to the hospital every time we have a problem. And I myself is at fault now. We'll run to the hospital and hardly see our family doctor anymore. But that becomes a problem over time. It's not sustainable. So as you develop further, you find that this shift over time in the process of development, where the center of gravity shifted towards acute hospital, is not sustainable over time. Why not? One, we are aging rapidly. 1 in 6 Singaporeans now is above 65. In 10 years' time, 1 in 4. So the number increased by almost 1 million in absolute numbers. And they will fall sick. And by the time they are sick and they turn up at the acute hospital, needing a bed, needing operation, is too late. So aging forces us to think, how can we prevent someone from falling so sick and then appearing at the hospital? What can we do that is preventive in nature? Intervene much earlier so that they don't fall sick. Or if the first signs of sickness happen, we can detect it quickly. And the only way to do this is through primary healthcare. Going back to my childhood days, where the first person you visit is not the hospital doctor, but your village doctor and the doctor in your neighborhood. And that is the person who can watch after your health, teach you how to have a healthy lifestyle, how to eat right, and nag you to put you through vaccinations every year, nag you to do your screening every year, and so that you can take care and prevent yourself from falling very sick. And this is the way for us to manage. Otherwise, healthcare costs and the entire burden on our healthcare system will be too much to bear in 10 years' time. From Singapore's perspective, when we do our estimation, today healthcare expenditure nationally is about 22 billion. If we don't do anything, if we don't improve primary care, that may triple to almost 60 billion by 2030. And that is the natural trajectory of things. And we should not accept the natural trajectory or the current trajectory as it is currently projected. Start to change the system, focus back to primary healthcare, shift the gravity back from acute hospital, back to community care, preventive care, primary healthcare. And I think we can have a very good quality system that's also sustainable.
Thank you very much, Minister. And I think your points around the sustainability and intervening much earlier are extremely important for all of us as we consider this across the region. Next, I would like to turn to the Minister, CEO, Honourable Minister from New Zealand. Your country recently announced the Health and Disability System Reform Vision, which included a strengthening of primary and healthcare as a strong focus. Could you please describe why this is important and what the government is wishing to achieve from this focus?
Thank you, Mr. Chair. Thank you for the question. Colleagues, kia ora, warm Pacific greetings. Our public health system is one of our greatest assets, and it performs well on a range of metrics here in Aotearoa, New Zealand. However, as with many health systems around the world, it has been under serious stress and does not deliver equally for all of our populations. Primary healthcare has always been a fundamental pillar of our healthcare system. So strengthening primary and community care is at the heart of our current reform process. In 2018, we conducted a review of our system and found that an increased emphasis on primary healthcare had the greatest potential to improve New Zealanders' health. The review also found that our healthcare was too fragmented. For example, we had 20 district health boards covering a population of just over 5 million. And this led to inconsistencies of care and practice, as well as what we call the postcode lottery, which means that where you live affects the level of care you access. So our response of the government to this review in launching this major reform is that, and what we've said is, we've got to make healthcare accessible for all New Zealanders, no matter who you are and where you live. In the future, our reformed health system will be people and family-centered, it'll be equitable, it'll be accessible, it'll be cohesive. So we're putting a greater emphasis on primary healthcare and ensuring fair access for all New Zealanders. Those are the two of the essential drivers of our healthcare sector reform. To achieve this vision, we're focusing on improving community level support with a locality approach to primary and community care. This is going to be tailored to smaller population groups than the previous structure. This approach is important as services will be designed around the needs and priorities of local communities, and people will have more options to manage their own health and well-being through access to information, advice, community support, and targeted services. I'm particularly keen to make sure that we're empowering individuals, families, and communities. So we're also addressing fragmentation by merging New Zealand's 20 district health boards into a single new entity called Health New Zealand. And Health New Zealand will be responsible for running hospitals and commissioning all primary and community care services. Also, enhancing digital health services is another essential aspect of achieving our vision of strengthened primary healthcare. Like many other countries in the region, we saw through COVID response that many services were able to quickly shift to using digital platforms without reducing the quality of care they deliver. But obviously, there are challenges in making sure that everybody has access online. Finally, we're strengthening the role our Māori, our Indigenous people of Aotearoa New Zealand play in all aspects of health and health services. We're establishing a Māori health authority with broad roles in strategy, policy, monitoring and commissioning. And this is going to be a game changer, we feel, for improving health access and outcomes for Māori, as we've learned of the importance of making available primary and community health services that are culturally safe and accessible for Māori communities, as well as our fast-growing Pacifica communities. Our hope is that over time, these reforms will ultimately lead to more innovative services which better reflect community priorities and needs, including more accessible digital and virtual care. This will deliver on New Zealand's vision of more equitable, accessible, and streamlined primary care services at the heart of a future-focused health and disability systems and better meet the needs of our communities, especially our vulnerable or at-risk community population groups. Thank you.
Thank you very much, Minister, and in particular for highlighting the importance in your policies around delivering equally for all of the populations. And I think you particularly highlighted engaging communities in both the organisation of healthcare and delivery as well as in their own role. I'd like now to bring in Minister Amelia from Tonga. Minister, you're developing a new national health policy as well, I believe, with a strong focus on primary healthcare. What will be different about the new primary healthcare in Tonga, and what would you like to achieve with it?
Malo e lau malia, and thank you, Chair, and thank you for inviting me to this very important session, and it is a passion of mine also. Primary health care is key to unlocking the future of the Tonga's population. Affordable and sustainable future, I mean, as health is wealth, and achieving our mission towards universal health coverage. It's just not only important to ensuring leaving no one behind, but at the core is that we can afford and we can financially support our healthcare system towards the future, given a projected burden of NCDs into the future. Thus, it will be potentially overwhelming for the people of the kingdom and the people of small island developing states and the Pacific to sustainably fund very expensive healthcare system. To strengthen the primary healthcare, we are also forging forward with decentralizing of health services. Tonga developed role delineation policy with the package of essential health services in 2019. But this package must be implementable, must be realistic, and must be sustainable in regards to the finance part. Such a plan must fully engage and partner and empower the local communities if we are to have anything sustainable in the remote island situations. Our new national health policy, which is currently in draft 2020 to 2030, has a vision for better future towards happiness and prosperity to all Tongans. And it has 7 pillars. First, universal health coverage. Second, governance, regulations, and policies. Third is very new, and that is primary health care driven. The third one is lifestyle revolution. This is power to the people, power for them to lead their own lifestyle change towards the future. 4 is on operational targets. 5, emergencies. 6 is international standard education and research. And this is a critical area that Pacific needs best evidence from their own situation, from research driven on the ground on their own people for better understanding, so we can better support policy direction. And finally, it's new partnerships and engagements of philanthropists, partnership with local businesses and local activists and champions who can lead the power to the people to move and mobilize lifestyle revolution. Our national health policy is in line with the package of essential health service to expand function for the primary healthcare services. And of course, with the lifestyle revolution strategy is one of the key strategy to be modeled in all environments, starting from the homes, communities, churches, working environments, in particular, the working environments of the healthcare. They must be able to facilitate movements, facilitate walking around, facilitate local food revolution in the working environment. We also would like to push and forge for local traditional food to be cooked in very delicious way that is delicious for all ages. And we support the work of the Pacific Island Food Revolution so we can build food and chef champions on the ground in the Pacific. Very recently, I have been meeting with our youth here in Tonga, and it is very amazing how the youth know very well the future they want. They want to live a healthier lifestyle. They would like to see reduction in accessibility to food around within the community system. So that is great going forward. Of course, like the Pacific, Tonga is within the NCD crisis, and of course, unsustainable if we are to focus on clinical care. So we must step up our partnership with the communities and with the youth, and that the work must be led by the youth. And of course, public health promotion and partnership with community is a significant part of the national strategy for better future for our children. Thank you.
Thank you very much, Minister. I particularly note the comment you made about the youth knowing the future that they would want to see, and also the importance of working in partnerships with private sector, with activists, with champions, and with the youth to help create that future. We have some minutes remaining, so I think we can go through another set of quick questions to the panelists, if I may. So could I come back to Minister Ong from Singapore? So you highlighted in particular the importance of this for the sustainability of the healthcare system, for the sustainability of health. And I think we're stressing some kind of urgency because of the fiscal implications. So how do you plan with the ideas that you have to make the future primary healthcare to be able to take some of those ideas that you were talking about and scale up quickly across the country to be able to make sure they have impact in the what is relatively narrow time available?
Huge question, deserving of a lecture in itself. But if I were to put it simply, I think today the problem that most healthcare systems in the world face is a misalignment of interests and incentives. And we know there are three big players in the system. The body that pays the bill, either government or insurance company, the provider of the medical service, mainly clinicians, doctors, and then the patient. So the three Ps, the payer, the provider, and the patient. And today their interests are not aligned. How is it not aligned? For the provider, they are often paid based on the workload and not the outcomes. And so the more I cut up people, the more surgery I perform, the more I get paid. And so the provider will just pay you based on your workload. And within that system, there is no incentive to say, can I perform fewer expensive surgeries and operations, but instead I devote my resources on preventive care, which is much better. Prevention is always better than cure, but today the funding system is not making that happen. And between the provider and the patient, there's also a misalignment of interest, especially if the patient is insured with a very good insurance policy. So whatever treatment I can get, I would like to have it, because it costs me nothing, it's already paid for. And the provider, remember, if he's paid based on his workload, don't mind giving that service to the patient. And so I think these are some of the features within healthcare not found in other industry that I think distort behavior and make us all go towards a direction where cost is just escalating and is not sustainable. So first and foremost, we need to fix the alignment of interests. And I think, just to put things simply, one is to just say that the system shouldn't be budgeting and paying based on workload and number of treatments and operation, but the system must pay based on outcomes, health outcomes, prevention of disease outcomes, prevention of readmission outcomes. If we can shift that, and that is a major public policy shift, I think we can gradually gravitate away from the hospital to primary care, to preventive care. I just want to highlight that we spent this conference and this meeting devoting a lot of time talking about COVID. And I think COVID gives us an opportunity to generate that consensus about primary healthcare and its importance and its primacy. And the reason is this: COVID, as scary and as devastating a disease as it is, ram home a few important lessons. Number one, to prevent COVID, by the time you are sick with COVID, needing oxygen or ICU, we know it's too late. How do you prevent that? Last year, every country start off with the most basic preventive measures. Hygiene, wash your hands with soap regularly, don't touch your face, don't dig your nose, don't rub your eyes, so on and so forth, and wear your mask. And these are very simple, very cheap things, very cost-effective things that we can do to stave off much more pain if you're not careful. Then second, the whole of this year, we are focusing on vaccination. And again, just look at the difference between an unvaccinated and a vaccinated person. If they are infected, what are their clinical outcomes? It's so stark. Vaccination just makes a lot more sense than not vaccinating and hoping for the best And when you're infected, very serious things can happen to you. And even if you are infected, the lesson we all learn is that the great majority now after vaccination in Singapore is 98.7%, have no symptoms or mild symptoms. So we don't hospitalize them. I think most countries come to the conclusion that if we can screen them, triage them, and identify them, the best way for them to recover with such mild symptoms is to recover from home. But to give them peace of mind, you provide them with some medical care through telemedicine, which again goes back is primary care. So I think throughout our whole experience with the pandemic, it really drives home the point that primary care actually was the main response to COVID, not the heroic things. While they are very heroic, things that is being done in ICU and in hospitals, those are really heroic acts of saving lives. But to keep the system sustainable, to help our society cope with COVID, it was about, and it has been about primary care.
Thank you, Minister. The points around aligning interests, I think, within the healthcare sector, to be able to make that vision come true is really important, and also the notes on COVID-19 and the role of primary healthcare in the response. Could I turn next to Minister Seo, please? Minister, you spoke about the importance of community engagement, working with communities, and also you noted, I believe, the establishment of a Maori Health Authority or board. Could you say a little bit more about these parts of the reform to improve primary health care, please?
Yeah, no. The reform is major. It's significant. And you only do this once in a lifetime. But we've learned from the past, and our data showed that for Indigenous peoples and minority groups, you know, their lifespan was less, anywhere between 6 and 10 years, as opposed to European parts of our population. Similarly, with children not accessing early primary health care, even when you look at the data around our women, Indigenous as well as minority groups, were not able to access primary health care or midwives. You know, and those statistics had guided the way that we're approaching our reform. In addition, we have treaty obligations to the Indigenous people. So when we say our approach is going to be driven by being family-centered, people-centered, we need to be looking at the population and our Indigenous obligations to the Treaty of Friendship, Treaty of Waitangi is what we call it. It's looking at how do we then address all the issues that people have been advocating for some time. And to do that, you've got to engage with them. You've got to engage with the leadership. And so we've been engaging not just with the people in our system, our experts, our doctors and clinicians, but we've also been engaging with the Indigenous leadership, our church leadership, our traditional, what we would call the chiefs of our Indigenous community and our Pacific community. And those input have been very crucial in helping us guide our way forward, helping us establish our principles, if you like, people-centered, having services that are pro-equity, because we are mindful that people have been calling out for equitable healthcare, and not everybody was receiving that healthcare in the past. So services that reflect that the community that they serve. We've said earlier in my commentary about having accessible healthcare. This is looking long-term, also making sure it's sustainable. We recognize that the austerity measures of past governments have not been good for enabling greater services to reach the multiplicity of populations that we have. Having it accessible in the languages that our people speak, and having it comprehensive so that it's, when we're talking about primary healthcare, it's everything. that a child needs: dental, eye, ear, mouth. And when we talk about being cohesive, we're talking about the continuity of care, making it simple and transparent. I suppose there are 4 pillars, Mr. Chair, that underpin our approach on population health. One is that we've recognized that we've got to have action on the wider social economic determinants of health. And so there's a work that we've got to do about making sure that everybody has access to a warm, dry home. Employment is a key determinant of a socioeconomic factor that impacts on people's health. The inequalities when it comes to wealth and power. The other factor is the behaviors and lifestyle. I'm talking about smoking, talking about exercise. I'm talking about the role that food plays, not only in nutrition, but also in our cultural practices. You know, alcohol and gambling, all of that have an impact. The third one is about looking at adapting our places and communities that we live in, the built and natural environment. And the final one is also about an integrated health and care delivery system. And the other factor, just to finish off, Mr. Chair, is that we also recognize if we're looking long term, we've got to have a strong workforce development plan in place, a pipeline, if you like, so that we're encouraging and supporting young people to get into the sciences from early on, so that we're not missing out on ensuring that we have a workforce that reflects the makeup of our community, a workforce that has language skills, multiplicity of language skills, a workforce that has cultural intelligence. So those are some of the things, Mr. Chair.
Thank you very much, Minister. And I note in particular the point you made about this is once in a lifetime, about engaging the leaders and the Indigenous leaders and all those many pillars that you articulated that roots or positions primary health care in a structure of many other interventions that need to be undertaken to help create a healthier future. Minister Amelia, this I think resonated a little bit with what you were saying about engaging in partnerships, and also you were highlighting in particular issues around food and nutrition. Could you say a little bit more about the importance of that in creating the healthier future and healthier primary health care in your plans?
A Tongan philosopher have come out after diligent research in Tonga that relationships is key to unlocking many potentials and unlocking huge capabilities for the future. So I believe in the importance of relationships, as have been said, with the multiple stakeholders within the communities. And of course, the traditional communities and the traditional leaders within the communities and the families are very, very important that we engage with them. And of course, for me, it's very important that diligent work must be done to look carefully into the strategic direction towards the future for primary health care, so that the key essential elements within that strategic plan will drive for the future we want, for the future for our children, for the future of the nation, rather than being influenced, and then the drive is taken somehow on detour roads, rather than what is much needed for the future we want for our children. And of course, there are key gaps within the primary health care, and one of the key gaps is basic resources and human capabilities at the remote healthcare centers, that we need to be able to have the benchmark of the physical resources that need to be there, the referral systems, the human capability that needs continuous professional education every year in order to be still deliver quality care for the people at the remote islands. And also that we are able to better support them. You know, working at far remote places, our healthcare team can feel isolated and feel so distant from the mainstream. So those are very essential elements that needs to support our team delivering at the remote context. In Tonga, we have implemented 3 strategies for enhancing primary health care at the remote island context, including our first family medicine, where doctors are engaged and trained. Second is nurse practitioners. We have trained more nurse practitioners to work at the remote. And currently we are working on training our village healthcare workers, village volunteers. Given these 3 approaches, we still need to be able to think of a sustainable future, think about the shift from clinical focus to primary healthcare focus, so that the whole team for the whole healthcare workforce can be sustained into the future. Thank you.
Thank you very much, Minister. And I think you also highlighted, as did the Minister from New Zealand, the real importance of a health workforce and a pipeline of health workforce ready for the future of primary healthcare. It's now time, sadly, to draw this discussion to a close. I think we could go on much longer, but I'd like to thank all 3 ministers. We've heard a lot about the drivers of why you are focusing on primary healthcare for the future, the drivers being a mixture of the issues of health and the change in disease burdens, and in particular non-communicable diseases and aging. We've heard about the financial drivers, the importance for future health budgets and balancing, and we've heard about the moral imperative to make sure that everybody can access healthcare and that all can benefit. We've also heard from you, I think, quite a lot about what will be needed to be put in place to be able to achieve those visions, elements of community engagement, leadership, lessons from the COVID response, some of the workforce issues, a lot there for us to think about. Now, this is thankfully not the end of the conversation. This is just the beginning. We have sessions on the agenda tomorrow morning at 7:45 and in the afternoon at 2:45, where we'll be very, very eager to hear interventions from member states around your thinking in terms of preparing for the future and preparing primary healthcare for the future. I would just like to express my own thanks on behalf of myself and I think everybody who's listened to this panel discussion, to the 3 ministers who have shared so much with your visions. We really appreciate your spending the time to share the visions of your countries, and we look forward to further discussion in the next sessions. With this, I hand back the floor to you, Chairperson.
はい、ティーラーさん、3人のパネリストの皆様、大変にありがとうございました。
Thank you very much, Mr. Taylor, and 3 panel members. We will now suspend consideration on this agenda item until tomorrow morning's session, commencing at 7:45 a.m. Standard Time tomorrow. Now we'd like to resume the session on the school health. We'd like to listen to your interventions, so we'd like to go back to the ones who have already raised hands. So we'd like to ask them to speak. First is Laos.
Minister, delegates, the government of Laos has strong commitment toward investing in the human capital in the ninth National Socio-Economic Development Plan 2021-2025. Education and health priority issue for the Lao government to enhance human resource development. Thus, the Ministry of Health and the Ministry of Education and Sport developed the National School Health Policy in 2010, which aims to advocate for political support and health promotion in school setting and achieve relevant sustainable development goals. It consists of 7 key components: personnel hygiene and life skills, physical school environment, psychosocial school environment, disease control and prevention, healthcare services, nutrition promotion, and cooperation between school and communities. One key priority is a school health deworming program. National survey in 2002 indicated very high level of soil-transmitted human infection among school-age children, as high as a 96% prevalence in some area. Ministry of Health partnered with the Ministry of Education and Sport to launch a school deworming program in 2005. By 2020, the prevalence infection was reduced to 17.7% at sentinel size, with treatment coverage being maintained above 90% of all school children nationwide. There are minor periodic issues with side effects, but the program will continue to maintain the target treatment coverage in order to protect school children. Under the COVID-19 outbreak, we do expand our vaccination for the school age of 17 and are working very closely with WHO and partners to cover school-age children. With the tobacco control law and alcohol beverage control law and drug control law, we will continue to work with relevant sectors to support combating against the use of tobacco and alcohol and substance abuse among children and adolescents in Lao PDR. We support endorsement of the regional framework for nurturing the health of our future generation in the Western Pacific region. I thank you.
はい、ありがとうございます。
Thank you very much. Next, we'd like to invite Cambodia.
If you can start, right? Honorable Chair, Dr. Takeshi Kasai, Regional Directors, Head of Delegations, ladies and gentlemen. Cambodia commends and appreciates WHO Western Pacific Region Western Pacific Regional Office for developing and presenting the regional frameworks on nurturing resilient and healthy future generations in the Western Pacific regions, which has a very innovative approach and a new vision for the futures. The regional framework is very timely for Cambodia. Currently, the Interministerial Committee for School is developing and the National Action Plan for School Health 2021-2030 and the regional frameworks will also be extremely important policy documents to align member state policy on school health with the WHO evidence-based recommendations. The Royal Government of Cambodia has already made significant progress on school health. The national policy on school adopted by the government and followed by the establishment of the Interministerial Committee for School held endorsed in 2020. The first healthy school has been established and launched in a primary health school in Phnom Penh, the capital city of Cambodia, creating the healthy school model in Cambodia on May 2020. With the WHO technical support, the health education syllabus on the healthy diet, physical activity, nutrition, mental health, and other health topics has been developed and included in school curriculums. Considering the impacts of COVID-19 on mental health and psychological well-being of children and adolescents, the Operation Guide for Psychological First Aid in School has been launched, and by now almost 1,000 teachers gain skill and knowledge on providing psychological support to pupils at school. This is a critical moment to prioritize the visions of the health through the life course by focusing on nurturing healthy children and adolescents. Herewith, Cambodia fully support and endorse the regional frameworks on nurturing resilient and healthy future generation in the Western Pacific regions. I thank you, Mr. Chairman.
はい、ありがとうございます。
Thank you very much. Next, we'd like to invite the Philippines, please.
Thank you, Mr. Chair. The Philippines recognizes the cruciality of having a regional framework for nurturing the health of our future generations in the Western Pacific region to achieve our collective for the future vision. This is aligned with the principles espoused by the country's policy of institutionalizing a healthy settings approach for learning institutions. Through health sector partnership with education agencies, the Philippines envisions that every student is in a healthy promoting environment from the moment they step into a daycare center up to the time that they pursue higher education. This supports the World Health Organization's Health Promoting Schools framework. The WHO framework is also supported by the country's health promotion framework strategy, which outlines the priority areas in health, including diet and physical activity, environmental health, immunization, substance abuse, mental health, sexual and reproductive health, and violence and injury prevention. Through this health promotion framework, knowledge and skills on the priority areas are imbibed by the students, their families, and communities. The country's Mental Health Act also provides the greater leverage in ensuring that investments on infrastructure, human resources for mental health services consider the school settings. WHO technical assistance to member states in terms of operationalizing the regional framework through the necessary tools and advocacy strategies on school health as a subsystem of health through the life course will be essential. It will be sensible to consider appropriateness of tools and strategies for various school settings, whether in the classroom or through flexible distance learning modalities due to the pandemic or for hard-to-reach populations. It's also important to outline the support from subnational stakeholders through a symbiotic relationship between learning institutions and the communities. Thank you, Mr. Chair.
Thank
you very much. Next, we'd like to invite Samoa. Please.
Thank you, Chairman. Samoa wishes to commend WHO for the commitment and leadership in development of the regional framework on nurturing, resilient, and health of the future generations in the Western Pacific region. Samoa government fully supports the endorsement of the aforementioned regional framework, focusing on nurturing healthy children and adolescents. This regional framework is very much aligned with key outcome 5 of our health sector plan 2019-20 and to 2029-2030 on improving maternal and child health. We fully understand the importance that the future of our families, our nations, and particularly our region are our children. Hence, we, the Pacific region, should stand together to develop and implement health programs that will contribute in promoting health and well-being of our children, especially in schools. Samoa, as a small island development state, puts more emphasis on nurturing the health of Samoan children in all settings, starting from the community setting to school settings, because we know and believe that protecting the health and well-being of the children starts from home. Some of the activities and programs we have already implemented include developing policies and strategies that contribute in promoting health and well-being of schools, such as the National Child Health and Adolescent Policy, National School Canteen Standards, National Immunization Policy, Health Promoting School Strategy, National School Nurse Policy, and School Nurse Program Guidelines. Advocating healthy changes such as healthy schools, communities, and workplaces. Amendment to the Infant Amendment Act 2019 and the Ministry of Education Act now mandates all children to be fully vaccinated before entering schools. Also strengthen the EBI program, management and implementation, and integrating additional health programs such as health promotion, nutrition, and screening programs for hearing and visual impairment, and school nurses programs incorporated into the PEN for Samoa rollout across the island. Prospective monitoring of the child health indicators, starting from year 1 at the school entry level to year 13, school living, in collaboration with our Ministry of Education. This monitoring mechanism will enable to intervene early at any age, especially childhood obesity, immunization status, physical activity levels, and healthy behaviors such as anti-smoking and alcohol-free behaviors. These developments, we believe, are all contributing to the implementation of the regional framework on nurturing resilient and health of the future generations of the Western Pacific. Paftai.
はい、ありがとうございます。続きまして、
Thank you. Next, Vietnam, please. Go ahead.
Chair. So Vietnam delegation would like to thank the Secretariat work on the rapid regional framework for nurturing the health of our future generation in the Western Pacific region. So Vietnam supports the framework, and we already provide our comment for this draft. And we appreciate it when our comment have been reflected in this version. Therefore, we have no objection for endorsement of this framework. School health is a priority of Vietnam, and the government issues the National School Health Action Plan 2021 to 2025. In terms of COVID-19 pandemic, Vietnam government issues the resolution number 128, which aims to safely adapting and effectively controlling the COVID-19, and the Ministry of Health also issues guidelines on how to implement the resolution. The government resolution outlines how public service can be provided and business can operate The government resolution and the Ministry of Health guideline also provide instruction on how the operation of the school at for risk level. At this moment, Vietnam is developing the national strategy for COVID-19 response, which including protection of school children, focusing on physical and mental health issues. We request WHO technical support to implement the National School Health Action Plan and the government resolution on COVID-19 adaptation and control, focusing on training for school health personnel on various topics, including quick testing and vaccination for school children. We also request WHO support to pilot health promoting school model for prevention of NCD and promotion of good habits for future generations. Thank you, Mr. Chair.
Thank you. Next, Korea, please, and then after that, Mongolia, please. So first, Korea, please.
Thank you, Chair. The COVID-19 pandemic has exposed children and adolescents around the world to a range of threats. The school closures resulted from the pandemic weakened the safety net schools provide children and adolescents. And the transition to online classes has widened the learning gap among students. The prolonged pandemic will not only affect the academic performance and the physical and mental health of the children and adolescents, but also harm their ability to socially grow and have a healthy future. Therefore, endorsing the regional framework at this time of crisis is extremely timely. The framework will support the future generation of the Western Pacific countries to defeat the negative impacts of the pandemic and live a healthy life. As diverse are the health risks faced by children and adolescents in each country, there will be a limit to how far we can go in addressing all the risks. Thus, it is important that WHO and the collaborating centers identify the best practices implemented by each country, share them, and provide tailored support to each member state. In the Republic of Korea, the Ministry of Health and Welfare, the Ministry of Education, and other relevant actors have joined hands to implement the policies to promote school health. Centered around our National Health Promotion Strategy, Health Plan 2030, we are working to promote school health by executing activities that could improve mental and physical health of students and make a safe and healthy school environment. Korea is monitoring the health status of adolescents by conducting youth risk behavior survey at the national level and is including children and adolescents in the National Health Screening Program. Protecting the health of children and adolescents do not only guarantee the lifetime health of an individual, but it also elevates the well-being of the family, regions, societies, and countries. In the long run, it would also reduce the cost of healthcare services to be borne by a country. Strongly believing that all children should be given access to equal opportunities, education, and school health services, the Republic of Korea endorses the regional framework on nurturing resilient and healthy future generations in the Western Pacific. Thank you.
Thank you. Next, Mongolia, and after that, Brunei, please. So first, Mongolia, please.
Mr. Chairperson, in Mongolia, the prevalence of NCD risk factors among school children has been increasing over the past years due to multiple socioeconomic, environmental, and economic factors. The 5th National Nutrition Survey reported several alarming findings of nutrition status of children. There was a sharp increase in overweight and obesity among children aged 6 to 11 years of age between 2010 and 2017. Consumption of unhealthy foods and drinks is common to 6 to 11 years old groups, with almost all children consuming any type of unhealthy foods and drinks at least once per week. In particular, 8 of 10 children were found consuming sugary drinks or deep-fried food. Expanding the original school meal program, the Parliament of Mongolia adopted a law on school food and manufacturing services in 2020, and subsequently the government endorsed a resolution on national program on school food manufacturing and services to ensure effective implementation of the law. The new program outlines objectives to have a unified supply of school food products, ensure proper management for food manufacturing facilities, and training human resources in the area, have adequate system for provision of nutrition standards and meal requirements. Mr. Chair, like other countries in the region, school-aged children in Mongolia have been experiencing the adverse health impacts of prolonged school closures during the COVID-19 pandemic, such as physical inactivity, unhealthy eating habits, disruptions in sleep, and increased vulnerability to domestic violence and online exploitation. This year, the government has decided to open and resume all school operations in phases, with lessons taking place both in person and through virtual connection, considering the COVID-19 situation, the vaccination rollout, and the needs of education for all children. Furthermore, all public schools will employ a full-time psychologist to provide psychological counseling and support to the students. Mr. Chair, Mongolia looks forward to further support from the regional office for adaptation of the draft regional framework on nurturing resilient and healthy future generations in the Western Pacific at country office level. On this note, Mongolia would like to endorse this draft regional framework. Thank you, Mr. Chair.
ありがとうございます。
Thank you.
次は
Next, Brunei and then Australia, please. First, Brunei, please.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and a very good afternoon, Chair, honorable ministers, distinguished delegates, ladies and gentlemen. Brunei Darussalam has always and will continue to be committed to advancing children and adolescents' health. Our commitment is reflected in the Ministry of Health Strategic Plan 2019-2023 goal to prevent and control NCDs by addressing the risk factors earlier in life, as well as exploring the need for establishing adolescent-friendly services. Towards improving the health, well-being, and quality of life of children and adolescents in Brunei Darussalam, the Ministry of Health, in collaboration with the Ministry of Education and Ministry of Religious Affairs, have undertaken several key initiatives, which includes, first, implementing a national school health services program, which covers various types of health screening for students between years 1 and 7 annually, immunization checks, as well as health talks. Secondly, introducing a voluntary school-based HPV vaccination program nationwide in 2012, targeting female adolescents in year 7 in line with our National Cervical Cancer Prevention and Control Program. Thirdly, developing and supporting the Health Promoting Schools initiative undertaken by selected schools based on guidelines that have been developed by WHO before this. Fourth, establishing school-based nutrition policies such as school canteen guidelines, drink water policy in schools, and further planning for restricting the marketing of unhealthy food and beverages in schools. And fifth, contributing and periodically reviewing various health components in the educational curriculum. We acknowledge that these invested actions will also help us in combating NCDs locally, and that they form an integral part of our healthy aging strategy by inculcating good foundation on health and positive health behavior among our school population, as well as simultaneously fostering an environment which can support these actions. Recent findings from our second global school-based health survey in 2019, however, suggest that more effort is required to directly address key NCD risk factors such as smoking and obesity, as well as for promoting mental health. Hence, we will need to look into ways on strengthening our collaboration with the education sectors and the local communities, supporting actions in schools, and also finding ways to show that our health promoting school initiatives can bring about positive health and academic outcomes. To this end, we look forward to hearing more on best practices and evidence from the region. Brunei Darussalam therefore welcomes the draft regional framework on nurturing resilient and healthy future generations in the Western Pacific and fully supports the endorsement of this document. Thank you, Mr. Chair.
ありがとうございます。次は
Thank you very much. Now the next speaker is from Australia and then followed by Fiji. So the next speaker is from Australia.
Australia thanks the Secretariat for their work on developing the draft regional framework on nurturing resilient and healthy future generations in the Western Pacific, and its efforts to combat NCDs by targeting early intervention. Australia is committed to the health and well-being of children and young people, and we acknowledge the important role of schools in promoting student health and well-being. In particular, Australia supports, number one, the framework's emphasis on addressing inequities and the social, commercial, and environmental determinants of health as one of the framework's guiding principles. Number two, the inclusion of Goal 1 on entrenching healthy behaviours in children that stick, to ensure that students have the knowledge, attitudes, values, and skills to adopt and maintain healthy lifelong behaviours. And number three, its strong focus on the adoption of tobacco, alcohol, and drug-free policies in schools, given the high prevalence of alcohol and tobacco use in the region. We support Malaysia's call for a focus on electronic nicotine delivery systems as part of future work. We also note the benefit of involving families in implementing school-based mental health and wellbeing initiatives. It is beneficial to encourage schools to provide learning and engagement opportunities specifically for families to recognise common student health issues, such as early signs of mental health conditions. Further to this, we wish to raise the following points. Firstly, whilst the framework does acknowledge the negative impacts of gender stereotypes and inequality, we note there are limited references to gender in the framework's goals and suggested actions beyond applying a gender lens. Examining the different impacts of the COVID-19 pandemic on girls and boys with their connection to schools and education may also be an area for further exploration. Secondly, we highlight the importance of adequate and equitable access to water, sanitation, and hygiene, or WASH services in schools to deliver healthy school environments and help instill healthy behaviours in children. This is particularly important for adolescent girls, as the framework identifies in section 2.6.6. Without access to adequate WASH services, adolescent girls are far more likely to drop out of school early for reasons of dignity and menstrual health and hygiene. Lastly, we note that the framework does not delineate approaches for primary and high school environments. Health education and appropriate messaging may differ between students in these age groups. We suggest the Secretariat consider explicit engagement on gender and the delineation of primary and high school environments in future work related to the framework. Australia is pleased to support the endorsement of this framework. Thank you.
Thank you very much. Next speaker is from Fiji and followed by Tonga. Fiji and Tonga. So the next speaker is from Fiji.
The Chairperson, the Regional Director, Dr. Takeshi Kasai, Honorable Ministers and members of the Forum, distinguished ladies and gentlemen. Fiji acknowledges the draft regional framework on nurturing resilient and healthy future generations in the Western Pacific and thank the drafters for the comprehensive and succinct draft framework. We, Fiji, fully endorse the focusing on and investing in the health of children is central to our region's collective vision of becoming the healthiest and safest region in the world. We support the three goals of 1, entrenching healthy behavior in children that stick. 2, schools influencing the community through utilizing a spillover effect. And 3, investing in schools today to build a healthier tomorrow, as it brings the education and health sectors together to support the for the future vision of the regional director. The Pacific Islands Forum endorsed the conception of the Pacific Regional Council for Early Childhood Development with UNICEF guidance and support, in the hope that the health and development of our children will be nurtured before they reach school, where the health promoting school program will pick up and continue the care, mentoring, and support. Fiji has been able to roll out the health promoting schools program with the support of multilateral partners to more than 300 of the nearly 1,000 schools throughout the country. 2/3 of the schools are primary schools, while about 100 secondary schools have started to implement health promoting schools program in their schools. The funding for this program have been obtained with assistance from the WHO Pacific Technical Division from the following multilateral partners: Australia through DFAT from 2009 to 2015, the Republic of Korea and COICA 2016 to 2019, and the government of Japan through the Japan voluntary contribution from last year till now. Our plans to progress the program to the rest of the schools have been stalled by the pandemic in 2020 and 2021. Fiji, like other Pacific Island countries, also faces challenges in schools of nutrition and non-communicable diseases, substance abuse such as smoking, and mental health. The COVID-19 pandemic has posed its own challenges in COVID-19 infected and sick children. Mortality, mental and social effects of public health measures, such as the halting of the school year this year for 5 months. In addition, we are mindful that some of the school health services have been delayed, such as immunizations for vaccine-preventable diseases. Meanwhile, Fiji has started vaccinating school children aged 15 to 17 with the Moderna vaccine. While it's not mandatory, we have covered 67% of the target population with the first dose and now on track to vaccinate more than 70% of this population. We are also on schedule to commence the vaccination of more than 45,000 children aged 12 to 14 years with the Pfizer vaccine from 15th November this year, with the generous support of the New Zealand government. Fiji wishes to propose the following 3 things. 1, that WHO, Western Pacific, and development partners continue to support Fiji and Pacific Island countries to roll out the health promoting schools program to all schools as was originally intended. Healthy children will be possible when all schools are involved and embrace the pillars of a good, healthy future. 2, that WHO Western Pacific Regional Office and multilateral partners continue to support our desire to vaccinate as many school-age children as possible and share innovative means and latest development and technological advancements that will promote and increase COVID-19 vaccination coverage for our children. And finally, that WHO Western Pacific Regional Office and multilateral partners support the policy development and appropriate legislative amendments and legal frameworks that support and protect the health and rights of all our children. Thank you.
Thank you very much. Next speaker is from Tonga, followed by Kiribati. So next is Tonga, please.
Thank you, Honorable Chair. First, our children is our future, and we have a very important obligation to ensure a holistic manner children are nurtured in body and mind as stated in our Pacific Healthy Island Vision, and Tonga has worked on improving school health over years. In particular, with WHO and the Japanese government, Tonga has been implementing health promoting school programs since 2019. This is a collaborative partnership among Ministry of Health and the Ministry of Education and Training and many other partners. Great progress has been made as measured by the school-based assessment measure. Many schools have transformed their school environment with cleaner wash facilities, vegetable and fruit gardens, enforced school policies, including prohibiting selling unhealthy food in school premises, and implemented school curriculums on exercise and healthy life education. We also want to see the change in the community as a spillover effect and always trying to involve the PTA and community in program and to promote children to be an influencer to improve health in the family and the community. This will take time to have impact on all the population, but we believe this is an important step for our future. This is stepping up a new rather than the traditional partnership approach. We need to engage major enablers and major challenges within the community. We welcome and endorse the regional framework for nurturing resilience and healthy future generation in the Western Pacific, investing in children and adolescents for the future with 3 goals and drenching healthy behaviors in children that stick. This relates to our lifestyle revolution in our new national health strategies with 7 key pillars. Secondly, schools influence the community through utilization of spillover effect. This is a new approach that needs to be modeled at school and led by school the healthy lifestyle and behaviors in order for healthy spill over from the school to the community. This can only be unlocked through new partnership. And lastly, investing in schools today to build healthier tomorrow must go inside with budget and investments in order that these goals are being facilitated at schools. The Kingdom of Tonga looks forward to strong partnership with schools, communities, and relevant key stakeholders for a better future for our children. I thank you, Chair.
ありがとうございます。次は
Thank you very much. Next, we'd like to invite the Kiribati and then Micronesia. First, Kiribati, please.
Thank you, Honorable Chair, Regional Director Dr. Kasai, fellow ministers, ladies and gentlemen. Kamnaben Maori, and warm greetings to you all from Kiribati. Enhancing our intervention in school health is a building block for the future towards a healthier and safer region. Children are our future leaders and our greatest assets, so their growth and development are critical. Despite our current activities in schools, which include WASH programs, physical education initiatives, promoting home and school gardening, smoke-free schools, food policies, to name but a few, are a great start. And there is a great need for us to fully integrate health into the education system. The greater our impact on schools and school children as incubators of health, the lesser our future health burden. Honorable Chair, malnutrition, which starts from an early age, including preschoolers, must also form part of our intervention. For us in Kiribati, one of the priorities of the Kiribati government is to start young with our requirement for children to attend preschool. And so we need to start our school health approach at this stage, particularly given our worrisome malnutrition statistics. Resourcing will always be an issue with us, small island developing states, but recognizing the long-term benefits, both economic and societal, we look forward to support from all of our development partners. The government of Kiribati looks forward to working closely with WHO and our development partners for the implementation in Kiribati of the regional framework for nurturing the health of our future generations in the Western Pacific region. You have my endorsement, Chair, for this regional framework, and I thank you all. Kambesindapa, asnabenintigaron.
ありがとうございます。次は
Thank you very much. Next, Micronesia, and then United States. Micronesia, please take the floor.
Okay. Thank you and good afternoon, Mr. Chairman, distinguished ministers and delegates. Federated States of Micronesia acknowledges the importance of creating a healthy environment for our schools, knowing that schools are the incubators for a healthier future for our people. This is an undertaking that Federated States of Micronesia fosters among our key partners and sectors, especially between health, education, and our communities. Creating healthy school environment for our future generation is a priority for Federated States of Micronesia that we forge with our partners to address obesity and risk behaviors in schools, focusing on physical activity and nutrition, strengthening enforcement of tobacco use and betel nut chewing policies, and strong enforcement of alcohol use prevention. Federated States of Micronesia has been providing essential preventive health services in our schools to ensure all children have access to needed healthcare services, including oral health, routine vaccinations, including HPVs, rheumatic heart disease screening and providing counseling for risk behaviors, to name a few. As part of Federated States of Micronesia's preparedness and response to the COVID-19 pandemic, we are strengthening screening, testing, infection prevention, and control measures for COVID-19 in our public and private schools. Federated States of Micronesia has also started to vaccinate our adolescent population for COVID-19 within our schools. Federated States of Micronesia continues to engage our communities and community influencers in promoting schools as the incubators for a healthier future for our people. Mr. Chairman, the regional framework on nutrition resilient and healthy future generation in the Western Pacific will indeed strengthen our schools and communities as incubators for a healthier future for our populations. In this regard, the Federated States of Micronesia would like to thank WHO for the development of this regional framework, and we fully support its endorsement. Thank you.
ありがとうございます。
Thank you very much. Next, we'd like to invite United States, and then after that, Singapore. United States, please take the floor.
Thank you, Chair. The United States would like to thank the Secretariat for its efforts in developing the draft regional framework on nurturing resilient and healthy future generations in the Western Pacific. Childhood and adolescence are crucial stages to establish lifelong behaviors supporting health and well-being, and school settings and the education sector can be vital partners in this effort. Investing in the health and well-being of children and adolescents is critical now more than ever. The United States is proud to collaborate with WHO, member states, and other partners in working to improve health across the life course. The draft framework represents an important milestone for the Western Pacific region. It can be a catalyst for valuable collaborations and partnerships among schools, governments, communities, and other partners working to meet challenges in child and adolescent health, development, and well-being. We encourage taking a multi-sectoral, multi-stakeholder approach as countries and areas consider implementation relevant for their own contexts. We acknowledge the importance of the range of health issues experienced among adolescents, including in sexual and reproductive health, behavioral and mental health, and the special challenges facing our young people during the ongoing COVID-19 pandemic. While the COVID-19 pandemic has compromised some of the progress made towards reaching the sustainable development goals, we remain committed to protecting gains and accelerating efforts to achieve the global goals. And we welcome this draft's framework's potential contributions towards those efforts. Thank you.
ありがとうございました。
Thank you very much. Next, Singapore, please.
Thank you, Chair. Singapore would like to thank WePro for its work on the regional framework on nurturing resilient and healthy future generations in the Western Pacific. This has come at an opportune time as the pandemic has led to a rise in obesity and physical inactivity, which are known risk factors for NCDs. Schools are a large part of a student's life and can play an important role in establishing lifelong healthy habits. In Singapore, the Ministry of Health, the Health Promotion Board, and the Ministry of Education work closely with schools to create health-promoting environments as guided by our Health Promoting Schools framework, and customize programs for preschools to tertiary institutions. Key initiatives include the inclusion of health and physical education in the curriculum at primary schools for children aged 7 to 12 years. This sets the foundation for all children and provides them with the knowledge and skills to practice healthier habits for optimal health and well-being. Recognizing the importance of empowering children and youths to choose healthier food and beverages in schools, HPB has partnered with MOE to establish the Healthy Meals at Schools program across all education institutions in Singapore. Besides these efforts, HPB supplements school with additional programs and resources to support our students, educators, and parents on tobacco control, mental well-being, and managing infectious diseases. HPB conceptualized developmentally appropriate activities such as assembly skits and workshops to help students acquire knowledge and skills to lead a healthier lifestyle. In addition to HPB's efforts, Singapore's 3 healthcare clusters have also spearheaded efforts to work with schools in their region to build awareness of healthy living and habits from young. This is with aim to drive better population health outcomes in their region. The National Healthcare Group, one of the 3 healthcare clusters in Singapore, has developed the Living Well at School pilot program and partnered with primary schools to build awareness and intrinsic motivation in the young to embrace healthy lifestyles so they grow up to be healthy adults. Parents and teachers are equipped with resources to scaffold the child's journey to embrace healthy living. Likewise, Singapore Health Services, another healthcare cluster, has also partnered HPB and Sports Singapore to roll out a Millennial Kids program. This is to inculcate healthy lifestyle and habits through talks on nutrition, sports, and wellness by its healthcare professionals. Singapore will continue to invest more in such preventive efforts, including in the digital space, so that we can have a healthier next generation. We look forward to the ongoing exchange of ideas and sharing of experiences with other WePro member states, and will continue to support WePro's efforts on this front. Thank you.
はい、ありがとうございました。他にこの議題に関してご意見。
Thank you. I wonder if there are any other interventions on this particular topic. Now, may I call on the Secretariat to respond to the points that have been made.
I know we are running up against the lunch break, so I'll try to make this very brief. Thank you to all member states who, for your excellent interventions and your support for this framework. It's really gratifying to hear all of your comments. Mr. Chairperson, before I respond to some of the member states' comments, I just want to say that the most important people in this discussion, children and adolescents, obviously don't have a seat at the RCM table, but we thought it was important that their voices be heard. We'd hoped to have a group of school students join us live today, but that wasn't possible. But we put together a very, very short video of a few students from around our region talking about why health is important to them, and we'd like to share that with you now.
because it helps my body to function well.
Nobody likes being sick, nobody likes being hurt, nobody likes being injured.
I can go to school every day and do all my classwork smoothly.
I can feel happy as I enjoy myself playing around with my friends and siblings.
It gives you strength and a better immune system.
So I can grow strong and healthy like mom and dad.
Health to me is healthy eating and eating the correct portion sizes.
Because we only have one life and we have to take care of it very well.
Try to stay healthy always from viruses and other sicknesses.
It means we have the ability to help our community and the people around us.
Why is health important to my future? So I can grow up free from being sick.
Also being mentally healthy, like being happy.
I can do my responsibilities and enjoy my time with other people.
I can continue my education in the overseas and to reach my goal as I want to be a doctor.
I can do and think of good things and reach my goals for my future.
It's also about being in a good and safe environment.
And to help protect the planet's future and the generations after me.
If I take care of my health well, I will be able to enjoy my future.
Longer life equals more time spent with your family and loved ones.
Because when we eat vegetables, we became strong. You will be more stronger than the bad guys, and then the bad guys will be scared.
Being stronger than the bad guys, so the bad guys will be scared. I don't think I could put it any better than that, Mr. Chair, on the importance of health for children's future. Mr. Chairperson, we had planned to continue with the Secretariat's response, but given the time, we don't want to rush it because there are some important comments to respond to. So I hand back to you to go to the lunch break. Thank you very much, Mr. Chair.
はい、ありがとうございます。
Thank you.
昼食の
We will now break for lunch. There will be a side event on innovation at 13:50 hours in Japan time here at the plenary hall, the same Zoom connection link as this session will be used. Following that, we will reconvene the committee tomorrow beginning with member state interventions on the panel discussion on primary health care commencing at 7:45 in the morning Japan time. For the member states with seats of government in the Western Pacific region, I would like to remind you that there will be a private information session as known in the COSAS meeting tomorrow, Wednesday at 9:30 in the morning, Japan time. A separate communication has already been sent out on the connection details and documents. Shortly after the conclusion of the COSAS, we will continue with the consideration of the next agenda item. So that brings us to the discussion at the second day. It has been a great honor for me to serve as the chair. Unfortunately, due to circumstances, I have to return to Tokyo. Fortunately, the co-chair from Tuvalu, Isaiah Tabe, the honorable minister, is happy to serve as chair for the remaining days. Minister Tabe, thank you very much. For the last 2 days, I have had your cooperation, and to this, I would like to express my heartfelt gratitude. I sincerely hope that the discussion in the remaining 3 days will be a fruitful one. Thank you.